Ladies and gentlemen, esteemed guests and distinguished speakers, good afternoon and welcome to the Global Health Diplomacy Summit 2024. My name is Alina, President of the Pharmaceutical Student Association of Taiwan, and it is my great honor to be the host for today's event. The summit, held in response to the World Health Assembly, focuses on two crucial topics: addressing public health needs amidst armed conflict and youth empowerment in global health. Firstly, youth engagement in health is essential. In Taiwan, student-led initiatives have driven substantial progress in healthcare through community outreach, innovative research, and public health advocacy. Their fresh perspectives and dedication are vital for tackling today's health challenges. Secondly, addressing public health needs amidst armed conflict is both timely and vital. Conflicts create humanitarian crises. Developing strategies to deliver medical service in these challenging environments requires international cooperation and the engagement of healthcare professionals. Today, we will engage in keynote speeches and panel discussions, aiming to deepen our understanding and inspire collective actions. Thank you all for being here. Now, it's my pleasure to invite Dr. Luo Yijun, currently Deputy Director General and Spokesperson of Taiwan CDC, and Adjunct Infectious Disease Physician at National Taiwan University Hospital. Let's welcome Dr. Luo Yijun to the stage.
Thank you, moderator. Ladies and gentlemen, especially distinguished speakers and guests, and also member and representatives of the Taiwan Healthcare Youth Alliance. Good afternoon. My name is Philip Ichino. I'm the Deputy Director General of Taiwan TDSA. I'm also on the FPHSATW advocacy mission Taiwan and President of the Ministry of Health this week. So it's always a pleasure to participate the Youth Alliance event, to see so many young faces and also guests from all over the world support the Youth Alliance home. Youth in Taiwan represents a major driving force in terms of the key milestones of Taiwan's democratic and also freedom progress. I'll give you a few examples such as the labor right protection and gender equality, and more recently the LGBT marriage legalization, and also HIV decriminalization. They were all driven by the youth voice, and later on lifted the agenda up to become a major change in the law or policy in Taiwan. So it's always a blessing to see the Youth Alliance advocacy and interest in various topics in terms of global health and related topics. I think today's agenda covers a wide spectrum of public health related matters that is not limited to only public health, but as a cross-discipline and multi-sectoral event that will take a lot of participation from the youth and also different generations' efforts. We may not expect to see the change immediately, but I think with previous examples demonstrated by the youth voice, I believe that this kind of engagement in the Youth Alliance and all your support will make things happen, will make change, and will make also all of you feel proud of yourself. So my ending remark is be ambitious and be confident and always be true to yourself. Thank you very much.
Thank you, Dr. Luo Yijun, for providing us with an insightful opening. It is now my pleasure to invite our second speaker of the opening remarks, Samuel, President of the Federation of Medical Students Association in Taiwan. Please join me in welcoming him to the stage.
Okay, so ladies and gentlemen, distinguished guests and participants, good afternoon and welcome to the Global Health Diplomacy Summit. My name is Samuel, and I'm the delegate from the Taiwan Healthcare Youth Alliance for WHO. It's an honor to have you all here today, as we gather to discuss the critical intersection of global health and diplomacy. Our Youth Alliance comprises students from medical, dental, pharmacy, veterinary, and public health fields across Taiwan. We are united in our mission to promote meaningful youth participation in health policy and issues, advocating for international support for Taiwan's inclusive in the WHO. Today, we will explore two crucial themes about humanitarian efforts and public health demands in conflict zone, and also the youth empowerment in global health. So the first topic, in the conflict zone, is imperative to find innovative solutions to provide essential health service and support effective population. At the same time, empowering youth people in the global health is vital because youth provide fresh perspective, innovative ideas, and brightness energy, which are essential for driving sustainable health initiatives and creating a healthier and more equitable world. I would like to express my deepest gratitude to all of you being here and for commitment to these critical issues. Together, we can build a future where health is a universal right by addressing public health needs in conflicts and empowering the next generation of health leaders. Thank you.
Thank you, Samuel, for giving us an informative opening. Without further ado, we shall start our first part of the event. Let's welcome moderator Jean.
Hello, hello. Distinguished speakers and guests, greetings. My name is Jean, and I'm very honored to be here as the first topic moderator. I wish you will have a very pleasant afternoon with us. The first topic of today's summit is addressing public health needs amidst armed conflicts, a humanitarian perspective. Given the current global crisis, many people are suffering from displacement and distress caused by ongoing conflicts. As we express our deepest condolences to those affected by war, we must ask ourselves on a humanitarian level, what can we do to help? Providing accessible aid and medical care is urgent and essential need for those caught in conflict. So our first discussion will explore the intersection of humanitarian efforts and public health demands in conflict zones, highlighting the resilience of the communities and the dedication of humanitarian organizations. Without further ado, I'd like to introduce our first speaker for today, Dr. Padmini Murthy. Yes, so Dr. Murthy is a global leader in women's health, known for her work on COVID-19 relief and other initiatives across multiple countries. She has received prestigious awards such as the Elizabeth Blackwell Award and the Presidential Lifetime Achievement Award. Currently, she is a professor and global health director at New York Medical College. She's also the chair of Intersectional Council, and she's the past chair of the International Health Section of the American Public Health Association. She is also leading the global health for the American Medical Women's Association and represents NGOs at the United Nations. Now, please join me in big hands for Dr. Padmini Murthy for her speech of the event addressing public health needs in armed conflict.
So I don't like to stand on the podium because I think it's nice to walk around so that nobody sleeps. But first of all, thank you so much for having me. And I always say, to my dear friends and colleagues from Taiwan, I'm 1/3 Indian because I was born in India. I'm 1/3 American because I'm a US citizen. And I'm 1/3 Taiwanese because I have a great connection. So thank you so much for having me here. And thank you all for your opening remarks. And it's so nice to be with students, because as I was talking to my esteemed colleague here from Taiwan, because you are the future. You are the torchbearer. So thank you for indulging us and having us here. I think I need, thank you. Thank you so much. Great, thanks a lot. Yeah, so when I was asked to speak, I said I'm going to talk about why public health is so important, especially now, because we have so many, okay. Don't you love it when technology doesn't work? Oh, great, it did. It heard me. So as you can see, I have this up here, and this is what is happening. It's just not restricted to one area, folks. It's everywhere. Because before I start, you need to know there are internally displaced people, there are refugees. There's a thin line between them, technically. But basically, they're people who are displaced from where they're living. And that is why, and the humanitarian conflict is increasing. And unfortunately, I'm not saying that, no, go back. Because I am a mother or a woman, okay? Listen, great. Because women and children, unfortunately, are most vulnerable. How many of you remember that women, during the horrible conflict of Czechoslovakia, when it became Czech Republic and Slovakia, women have always been used as weapons of war, and girls. So this is terrible. And also, what can we do as a community? Because when we talk about multilateralism, you know, everybody's talking, and I'm so glad you talked about the pandemic accord, because pardon the expression, it's going south. It's not going anywhere as of today as we speak. Hopefully, there's something which happens before Saturday and people reach an accord. The reason I say that is because really the world is absolutely burning. Okay, no, come on, sorry. Okay, so I just wanted to talk very briefly that we have all these, as you can see, the physical, social, and socio-economic environment. What is happening? We are concerned about disruption of public health programs. Do you know that before I start saying everything is so pessimistic, I'm somebody who's an optimist. I'll say that my glass of water, thank you for bringing it, is half empty. Not saying that, I'm going to say it's half full. Do you know that Malawi was declared free of malaria just 2 days ago? The reason I'm bringing this up is that's an example of positive multilateralism. And Malawi couldn't have done it without other global actors joining. So, disruption of public health problems. What is happening everywhere in the world? It's burning. Why? We have enough money, but we are spending it on the wrong things. We are not, by saying, why do we have war? We are not anti any nation, but you're anti-war because we need to have peace. You know, if you see outside the palais by the broken chair, I don't know why we don't realize that we are breaking all the other legs too, just not one leg. And you can see there's peace written in different languages. If you haven't, you should take a walk in the square and see peace is written on different languages. But what did not surprise me, that it's right to the end. It's not where you can see it. That's the place peace has today in the world. Because unfortunately, it's become so elusive. It should not be. Now, look at the psychological trauma. And then we have displacement, social dislocation, migration, war, wealth, all these, this is interconnected. But I just want to talk about the psychological trauma. It's increased. When you're displaced, you are in unfamiliar surroundings. Now, if you're a mother, you need to make sure your kids eat. So who do you talk to about your trauma? You internalize it. So what happens if you internalize trauma? And don't tell me, you know, you medical students, I tell my medical students and my public health students, oh, don't say that because we are listening to professors' lectures, we are internalizing our trauma. That is not trauma, folks. We push you so that you realize who you are and you push others because it's a ripple effect. Now, do you know, apart from the trauma they're facing, so many people have committed suicide. And I'm just going to digress for a minute. A colleague of mine, I just know her as a colleague, not a friend, was an ER physician during COVID. She could not take it anymore. She committed suicide. a brilliant physician who was a musician in New York. Why did she do it? Because she could not get help. Because it's being pushed onto you. This is what is happening during armed conflict. When you're displaced, who do you talk to? We are all human beings. Yeah, we are healthcare providers, we are professionals, but you're a human being. Like if I cut you, you will bleed the same as if I cut myself or somebody else who's not a professional. So this is something we all need to be aware of, and this better listen to me and work. Okay. Yeah, you did? No. Okay. Go back. Unfortunately, some of the worst public health catastrophes are experienced during armed conflict. And suicide bombers. Women have been brainwashed into becoming suicide bombers. So I'm just talking, the reason I'm talking about gender here is because women are at the brunt. Whether they're facing the effects or whether they've been brainwashed or they think that their lives are so horrible, by doing something drastic like this, they may bring, some peace or help others. I don't know, but the whole effect is so sad. And one of the other things you need to know is there are profound public health consequences, short and long term. Short term is you can get hurt, you can die, there's no food. These are short term, you're displaced. Long term is the psychological trauma. Yeah, and PTSD. Because a lot of people still have PTSD from COVID. So can you imagine these wars which are ongoing and ongoing everywhere? And it's just not one region. In the United States, we have a lot of people fleeing, especially from countries like Venezuela, trying to come to the US, my country, again, because they're trying to escape armed conflict. They come here, not everybody is lucky to come into the country. It's happening everywhere, the migration. So, but why do you think it's happening? Because we are not addressing the root cause of the problem. We are not fixing what is going on. It's like if the foundation isn't strong, you can't do anything. What you build, I mean, if this was unstable when you went on, it would fall. So you need to make sure your foundation is strong. And what is happening in public health systems, which are already being ravaged due to cuts, because the money is being spent to defense and war, when your public health infrastructure is kind of shaky, it's going to collapse. That's what is happening. Women are giving birth without water. Women are giving birth with no aid. And when we talk about safe motherhood, we are not able to give them the basic human rights. Women are dying giving birth, which is unacceptable. There is no cure for maternal mortality, folks. You're all in the health, but it can be prevented. So, and the same thing for even infant mortality. Listen to me now, okay? Now, unfortunately, a child exposed to war is at an increased death in infancy or becomes an orphan. And the biggest issue we have is behavioral problems. So many children are experiencing behavioral problems, increased drug use. Okay, I didn't do anything. I'm not guilty of that. So this is a big issue. So what is happening? You're depressed. But a lot of times depression is like, oh, don't talk about depression. Why? It's normal. One day you're happy, one day you're sad. We are all human beings. So we can't talk about depression. We can't talk about a period. It was World Menstrual Day. And women who are living displaced do not have access to safe and clean menstrual hygiene products. We need to remember that. And a period is not a dirty word. Because if our mothers didn't have a period, none of us would be sitting here. It's normal, it's biological. So we need to be focusing on all these things. Because there was an earthquake in Nepal a couple of years ago. So my medical students and I, what did we collect? We collected shoes, we collected socks, and we sent a whole lot of sanitary supplies. Because women did not have access. So one thing I want to say, when you're thinking of doing aid, you need to be practical. One of my colleagues goes like, oh, Minnie, we'll send them the menstrual cups. I said, they have no clean water. How can they wash the menstrual cups? So remember, when you're doing aid, there's no one shoe which fits all. You need to assess individually what the situation is. Okay, so now what happens? This is terrible. Like if you do a SWOT analysis, and then remember, when you do a SWOT analysis, I always tell my students they can be interchanged. Strength can be a weakness, weakness can be a strength, opportunity, threats, they're all interchangeable. Coming to this, needs of the civilian population are not met. We have enough food in the world, but the distribution is horrible. And the wars, the conflicts have made it worse. Now, humanitarian organizations are denied access. This is the harsh reality. I mean, so many of you who worked in some way or the other with Doctors Without Borders or other relief organizations, remember what happened to the World Kitchen Aid? They died, young people. So this is what I'm saying. They're denied access or their lives are in danger. And the bureaucratic hurdles. Great example is right in our backyard here at the WHO. The bureaucratic hurdles to get the pandemic preparedness treaty passed, which is very sad to so many of us in health, because it's everybody's health we're talking about. You need to understand it's not a clash of egos or the negativity of geopolitics. Get something done which actually works. Those of us who are practitioners, it's very frustrating. Because let me give you an example. Okay, I'm Indian American, but if I had a patient from a country which was at war with the US or with India, I'm not going to say, ooh, I'm not going to treat that patient. You don't. Because humanity transcends everything. Relief work has to transcend everything, but this is not the case. It is so sad. And also, they face security challenges and there's no protection. Like these young people who died, they were not protected. So many times, so many UN peacekeepers, so many people, so many of us who go to volunteer, you don't know if you're going to come back or not. But we all know that, but we go it because we have humanity. Because the color of humanity is the same. It doesn't matter, I'm brown, you're white, or somebody's green or yellow or orange. It's the red blood for us, so it's because we care. So that's a big issue. Okay, now, the role of health professionals in armed conflict. What do? They have to contend with dilemmas because, it's like being a parent. I'm a parent, and I always tell, we all agree, like when you become a parent, those of people who are parents in this room, do you get an instruction manual when you get a baby? No. Thank you, Sharina, for shaking your head. You just learn like that. Now, this is something we don't have. We don't know what we have to do. And sometimes the situation is changing, ever changing. You don't know what to do. Now, you're a surgeon. You go into the theater. I used to be a surgeon. I don't know if I can do a cesarean section or I have to, or there'll be a uterine rupture. So I have to be prepared to face any situation. But I am confident because I have the training and the equipment. But in a war zone, you have the training, but you don't have the equipment. What do? This is a big question we have to ask each other. And also, impartiality, neutrality. Because so many times in the current armed conflicts, the Geneva Convention is totally violated. We have the Red Cross there. It's a beautiful museum. If you haven't seen it, you should go see it. But it shouldn't be a museum. The Geneva Convention, the Istanbul Convention, they're all like, they're just pieces of paper, which is so sad. Okay, now we have the IHL, or the International Humanitarian Law, which is a set of rules which is supposed to limit the effects of armed conflict. So my question to all of you in the room, do you think this is being followed? Just a yes or a no. If anybody says yes, I'd like to know why you say yes. It's not being followed because there's no accountability. That's one of the biggest challenges we're facing, is a lack of accountability. And humanitarian aid. So when you're sending aid, now do you send food? Do you send medicines? Do you send vaccine? Do you send personnel? Who do you send? If you can only send 2 convoys, how do you pick it? Right? How do you pick that? We don't know. Okay, so what is fear? It's just not like a global thing. So this is really interesting because fear has, like, it's a humanitarian charter, their protection principles. There are a few core principles: water supply, sanitation, and hygiene promotion. Do you think there's clean water supply during an armed conflict? Even at the best of times, so many people do not have access to clean water, which we are drinking. So, and then, do you think there's food security during armed conflict? Because they're burning crops. In so many places, they destroy crops. And landmines. How many of you know about landmines? They're the worst things in the world. They're really weapons of mass destruction because it doesn't know, a landmine cannot differentiate between the foot of a soldier or the foot of a child. It's horrible. Like, I was in Cambodia a few years ago, and if you see that museum, you feel so sad. Where, you know, the Khmer Rouge, they had all the landmines. You know, it was one of the, Vietnam was one of the Cambodia, the rice belts of Asia, and they pretty much kind of, they were decimated for a long time because of all this. So, again, and then also health action. So what do you understand by the term health action? It's not only the action we take as healthcare professionals, but what is the action that governments are taking? What is the action you're taking? So it's just not, it has to be an umbrella. And then code of conduct. Unfortunately, the code of conduct is not always there because there's so many reasons when, you know, you start getting into, because when you start losing your neutrality and you're not focused on your mission, but you start thinking, oh, that's from that person, they did this to my country, so this is my chance to take revenge. Humanitarianism is not about revenge, but it's easier said than done, you know? Okay, so what is the humanitarian law? As you can see, the principles of humanity, impartiality, independence, and neutrality. So independence of the people or of the country, of the place where the conflicts are taking place. So this is the definition according to OCA, and you know, it still holds after like, what, 14 years, 15 years. So these are the core humanitarian principles, but unfortunately, neutrality is not maintained. So that neutrality does not necessarily need to go into only the humanitarian, it needs to go everywhere, just not to the health professionals. Okay, so what is happening here? Humanitarian aid. There's one more being given an effect. There's so many people. And I can share an example of what, another positive example of multilateralism. So during COVID, now those of you in the US, I don't know if you know, those of you who are not familiar with the US, we have the Navajo Nation, where we have all our Native American population in a great part of the US. Now, they did not have access to masks. So what we did is, when they reached out, so American Medical Women, that's my NGO, we worked with Suu Kyi, I'm sorry if my pronunciation of the name is not correct, which is a Buddhist Taiwanese NGO. And we worked with the Arizona Attorney General's office and medical students like all of you. And thank you for the time, I appreciate that. And also all the other, the pilots who gave their time free, and we dropped supplies to the Navajo Nation. So that was a great example of what, you know, positive partnerships, which is what we need to do. Now moving on. Okay, so I just wanted to share this with you because this is from our archives in American Medical Women's Association. You can see all these women, they went to help in war during the Second World War. Why? They were nurses, they were doctors, they were not even paid. They said, we don't care, but they went to work with the soldiers in the trenches to help them out. So this is what they did. This is humanitarianism. They helped German soldiers, they helped everybody who was wounded. They didn't say, oh, we are American, we are not going to help somebody else. So, and these were the contract surgeons. These were members of the American Women's Health Services, because as I said, the US military would not accept women physicians. So these women got together. That's one of the things of AMBA. I'm so proud of my NGO. We've been around for 109 years. I'm not 109, but I'm just telling you. So these people, and they had a lower salary, and they became contract serving in the US Army. So these are the contract surgeons. So peace mediations, just want to tell you, Uganda, during wartime, these people are peace mediators, women working with the local women, selling their products so that they have to get a living. And remember, when there's war, women lose their livelihood. So what do? Best practices. This is children are learning, even in war times. You know, UNICEF drops the boxes. It's called School in a Box. So they get them. They're still being taught. And I was at this event yesterday where there were all these entrepreneurs, and somebody from India came up with this long-range internet, which they're using in the tribal regions of India, and they're going to take it to Africa too, where you don't need internet to be connected. So these are some of the things which are coming. And you can see that He for She is a great movement. You, all the men in the room, you guys should sign up. It was started by the former Secretary General Ban Ki-moon, where men support violence against women and how to do it. And this is the problem we have, folks. Women constitute 70% of frontline workers. So it's a double whammy. They're the ones most affected and also as frontline workers. And then we need to have gender inclusive measures. How are you going to protect the women? Which is easier said than done. It looks nice on the slide. So again, as I'm wrapping up, recommendations. Neutrality, we don't take sides. Independence, that means nobody can tell us what to do. We can make our judgment based on the scenario there. Impartiality, which is, you have to be impartial. Like you can't say, oh, I'm going to treat him because he's a man, but I'm not going to treat the woman. Humanity. And you need to ensure the dignity of the people whose needs you're addressing as well as your own dignity. So, key non-state actors, as I'm wrapping up, Médecins du Frontier, American Red Cross, International Red Cross, International Rescue Committee. These are some of the faith-based organizations, Suchi, Islamic Relief, CRS, the Catholic Relief Services, BAPS. That's from India. All these people do a lot of work. So thank you, and a lot of NGOs. And I kept her time before she says, your time is up, you have to get out. So that's all we have to do, is look beyond that. And the last thing I want to say is persistence, patience, positive attitude, and it's team building. Thank you so much.
Thank you, Dr. Murthy, for this remarkable sharing on, realizing what is the current problem and what is the need and the conflict zones and what has been input. And next, I am very honored to introduce you the next speaker of the day, Dr. Lars Schudelen. Hope I didn't pronounce it wrong. Dr. Schudelen is the Vice President of the International Pharmaceutical Federation. He brings a wealth experience in nonprofit organization management, and over the years he has built strong connections with Taiwan, participating in a lot of events, including the annual International Medical Education Congress hosted by Taipei Veterans General Hospital and the FIP Technology Forum at the Taiwan International Pharmacy Advancement Association. We're very honored to have him with us today to discuss the crucial role pharmacists play in humanitarian crisis and to share insights on the International Pharmaceutical Federation's RX Humanity programs. Now, please join me in welcoming Dr. Schudelen and his speech.
Thank you. I'll give this to my colleague. Varna? Yeah. Thank you so very much, dear colleagues. Thank you so much for the kind invitation to participate in this very important session on addressing public health needs amidst armed conflict, a humanitarian perspective. As mentioned, my name is Lars Söderlund, and I am the Vice President of the International Pharmaceutical Federation. In this presentation, I will briefly explain to you what FIP is and what we are doing as a federation in our humanitarian program. Founded in 1912, so we are 112 years old. In the Netherlands, the International Pharmaceutical Federation is the global body representing pharmacy, pharmaceutical sciences, and pharmaceutical education. We are in official relations with the WHO since 1948. And through our 153 national organizations, academic institutional members, and individual members, we represent over 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators all around the world. We work to support the development of pharmacy profession through practice and emerging scientific innovations and through developing the pharmacy workforce in order to the world's, you can say, healthcare needs and expectations. As you can see in this slide, the humanitarian program is one of our priority programs at FRP under our global health priorities. And as you know, we have been witnessing a growing number of disasters from different types of causes, leading to more than 300 million people worldwide in 2024 that will need humanitarian assistance and protection. So we have also identified several FRP member organizations that set the program as a priority for their regions and for their countries. The humanitarian program within FRP, branded as Humanity RX program, highlights the support FRP can provide to support pharmacists and pharmacy teams in crisis. Doesn't work, the point? Yeah, thank you. Reflecting on the essence of the RX suffix, we see it as our prescription to the world. A call to action for leveraging pharmacies to advance equity, sustainability, and now humanity. So Humanity RX signifies our collective commitment to embodying the qualities that define our shared human experience: compassion, empathy, and solidarity. Compassion, empathy, and solidarity. So this program showcased the different humanitarian initiatives carried by pharmacists across the globe to demonstrate how adaptable the profession is, depending on the crisis at hand and how colleagues can be more involved in supporting healthcare delivery in disaster and emergency settings. The FRP humanitarian program focuses on the actions pharmacists can have in disaster and emergency situations and providing support to our member organizations and working collaboratively with other NGOs on this area. And besides the production of resources in this area, we also aim to fully engage with all our constituencies in support of delivery and concrete actions across the entire federation in this area. So FIP, through the provision program, acts as a conduit between members with needs and priorities for quality training and professional development programs and CPD providers who also might be partners to FIP or members of FIP. So it's about quality training, professional development programs and courses. And by this, FIP is providing a global platform for engagement and collaborations to build knowledge and skill bridges where desired and needed in different regions and nations. The FIP development goals, launched by the International Pharmaceutical Federation in September 2020, are a key resource for transforming pharmacy, the pharmacy profession over the next decade globally, regionally, and nationally. And they align with FIP's mission to support global health by enabling the advancement of pharmaceutical practice, science, and education, and are set to transform pharmacy in alignment with the wider global imperatives underpinning the UN Sustainable Development Goals. And it's important to mention that FIP's 21 development goals actually reiterate the FIP's commitment to bettering global health through pharmacy. And this program is particularly linked to the development goal number 18, access to medicines, devices, and services, as it highlights the importance of equitable access to health, regardless of settings or situations they are in. It also aligns with several other development goals, such as development goal number 10, equity and equality, number 15, patient-centered care, and number 19, patient safety. As part of the humanitarian program, we have published several resources, including frameworks and guides, toolkits, and FIP commitments and policy statements that support the pharmacist and pharmacy profession in the humanitarian activities and different settings. And those can all be found at our microsite, humanitarian.fip.org, humanitarian.fip.org. So FIP supports the growing recognition of the crucial role that pharmacists and pharmaceutical professionals play in addressing global health challenges. For that reason, the FIP humanitarian program includes a dedicated section on pandemic preparedness and response, providing assistance beyond traditional humanitarian aid efforts and by actively engaging in proactive planning and resource mobilization to tackle pandemics and disasters effectively. So the integration of pandemic and disaster preparedness within the humanitarian framework underscores our commitment to improving global resilience and safeguarding human well-being. And by empowering pharmacists and pharmaceutical professionals to respond efficiently to crises, the program aims to minimize the adverse effects emergencies have on communities worldwide. Through our collective efforts, we actually, within this program, strives to foster a more resilient and a more prepared global healthcare system, particularly pharmacists in this case, for the challenges of tomorrow. FIP has hosted several digital events to highlight some lessons learned from countries that have faced humanitarian disasters, as well as the important role that pharmacists can play in those settings. And by acting as a platform for colleagues to share the experiences, FIP aims to focus on preparing the pharmacy colleagues around the world to be better prepared for future disasters. And at the bottom corner to the right, you can actually see a campaign we had that aimed to highlight or raise awareness of the roles pharmacists play in humanitarian settings. One of the important publications of FIP is the FIP Global Humanitarian Competency Framework. It was launched in 2021. The aim of the FIP Global Humanitarian Competency Framework is to provide a set of competency standards for pharmacists and pharmacy technicians who are involved in humanitarian aid and disaster relief services or efforts. And the framework was developed by FIP in collaboration with various different stakeholders, including pharmacists, humanitarian organizations, and government agencies. And the framework actually includes a set of competency standards that fall under 4 different domains, as you can see here on the slide. Pharmaceutical care, such as conducting medication histories, providing drug information, and managing medication therapy. Pharmaceutical public health, such as disease surveillance and response, health promotion and health system strengthening. Organization and management, such as inventory management, logistics, and budgeting. And finally, professional personal development, such as self-awareness, cultural competence, and leadership. And this framework is available in English, in Turkish, in Arabic. And we are working together with our member organizations to translate it to as many languages as possible. Here are 2 examples of statements of policy, documents for the humanitarian program within the International Pharmaceutical Federation. The first one to the left was actually launched at the World Congress of Pharmacy in Seville, Spain, 22, to highlight the efforts and commitment FIP set to this program of work. And the other one to the right is the role of pharmacists in disasters and emergency management. It was launched in Brisbane last year at the World Congress of Pharmacy and highlights and reinforces the presence of our pharmacy colleagues in humanitarian settings. So in both documents, there are linkages made and emphasis on the importance of partnerships, collaboration, assurance of pharmacy education quality, and having an overall vision for pharmaceutical education as well. So pharmacists can play several roles in humanitarian settings, usually under multidisciplinary teams that focus on access to medicines and services in different areas affected by a disaster or another emergency situation. And some of these roles include medication management, such as to ensure that we have a steady supply of essential medicines and distribute them efficiently in challenging situations, inventory control, to manage medication stocks, preventing shortages as well as wastage, patient care. Well, we do a lot of medication counseling. We provide information to patients about the medications, emphasizing the proper use and potential side effects, as well as adherence support, where we work to enhance the patient adherence to prescribed treatments. That is actually very crucial for positive health outcomes. We have the clinical support, collaboration with other healthcare team and other healthcare professionals in order to optimize patient care strategies. Treatment planning, where we contribute to the development of treatment plans, taking into account medication safety and effectiveness. Public health initiatives, for example, health education, where pharmacists engage in educational campaigns promoting disease prevention and a healthy practice, as well as immunization programs, where we often play nowadays a key role in organizing and implementing immunization campaigns in response to potential outbreaks. Furthermore, preparedness and response. We have emergency supply management, where pharmacists are involved in preparing and managing emergency medical supplies, ensuring a rapid response to the crisis, and coordination with relief teams as well, where we coordinate our working efforts together with the other teams to address the healthcare needs of affected populations. And of course, quality assurance, where pharmacists verify the quality and safety of medications, particularly in situations where counterfeit drugs might be a concern. And of course, monitoring adverse events as well, where we actively monitor and report adverse events to medications, contributing to an overall patient safety. And finally, training and capacity building. Pharmacists contribute to the training of other healthcare professionals as well, especially in the context of disaster response and humanitarian aid, and also community education, where we educate local communities on medication safety, proper use, and health practices. As a global federation, FIP supports our members through some of the steps outlined in this slide. Information gathering, we identify member organizations and individual members in the affected area. Information sharing, where we share information with the members, relevant stakeholders, etc., to learn a lot more about these initiatives. We seek further information from or coordinate efforts with other leading organizations, such as the WHO and the World Professions Alliance. And we have needs assessments. With the support from our members, we actually can identify the most pressing needs of affected populations. And we try to identify the most appropriate resources, of course. Could be letters of support, could be donations, guidance or reference, document, advocacy, etc. And a follow-up and monitoring, where we track the progress and identify the possible gaps, as well as we document and report to learn again. So in the last years, FIP has been developing a set of responses to our member organizations that aim to provide support to colleagues across the globe. The response is actually coordinated in response to a request by the affected country and targeting specific deliverables that can be used to increase pharmacists' involvement in the response to disasters. Often meeting with a colleague is used to identify the most pressing outcomes where FIP can support in the short term, and also identify possible outcomes for the mid and longer term. So if we can come to the next slide, perhaps. Yeah, that was where we have actually contributed to different emergencies and disasters all over the world during the last years. And let's go to the next. Oh, sorry. Yeah. And then I would like to conclude this presentation by thanking you for your attention, and also I hope that you found this presentation useful to learn more about the humanitarian program within the International Pharmaceutical Federation. There are, here you can see the contact information for the FIP staff members that are working on the development of initiatives under our humanitarian program, and the contact details if you have any relevant questions or suggestions for collaboration as well. And I would also like to conclude by saying Think Health, Think Pharmacy. This is a new campaign launched by the FIP during the last days to raise awareness of pharmacies as places of primary healthcare provision and to advocate for pharmacists as healthcare professionals. The WHO actually sees us and identifies us as a healthcare professional. And despite substantial and recent advancement in the pharmacy practice, too many still perceive pharmacies as commercial enterprises rather than places of healthcare provision, which is an obstacle to the pharmacists providing those services that they have trained to provide and that our health systems and communities desperately need. And finally, our profession has proved its ability and dedication to the health of the communities during the COVID-19 pandemic, and now it is time to make a bigger push for more professional recognition and the additional pharmacy services that go with that. So this campaign is an important strategy for the development and advancement of pharmacy practice all around the world, and it will be a long-running campaign sustained through regular releases of new campaign materials and other activities. And also, I would like to thank our previous speaker for her fantastic presentation and saying that it's about professional collaboration. We need to focus on collaboration and professional activities together because no one can solve all the challenges by themselves. So together, we are stronger. Thank you.
Thank you, Dr. Shidlin. I mean, I say pharmacy student myself, I'm really, really fascinating about how what FIP has done, and then, you know, everything just tells us what we can do and act as a pharmacist in the future on a humanitarian level to give out aid and medical care in the future. Time flies, and here we are for our last speaker for the first section. And may I introduce her with great pleasure. She is Mandy Cai Jiaying, who is one of our delegates of Taiwan Healthcare Youth Alliance for WHA. Mandy is a preclinical student at the National Taiwan University College of Medicine, and she's also a research exchange student at McGill University. She has served as Vice President of Medical Education for the Federation of Medical Students in Taiwan. She's also the coordinator of Refugee Network Taiwan, and she has won several awards for her contributions to human rights and photography. So now please join me in welcoming Mandy and her speech for today, Use Our Fortune to Change the World.
Just wait for a second. Okay, so dear Dr. Mercy and Dr. Lars and everybody joining here today, no matter online or no matter in person, thank you so much for being here today, and thank you so much for having me here today. I'm Chang Tai from National Taiwan University College of Medicine, and it's really honorable to share a topic that's really close to my heart, refugees and humanitarian intervention. And today, I would like to use 20 minutes to invite you on a journey about using our fortune to change the world and about refugee stories. So I believe everybody is really tired, so I would like to ask everybody a question. Did everyone sleep well yesterday? Yeah. Yeah. Everyone had different answers to this question. Maybe you're just very, very excited about our event, and maybe you're anxious about something else happening, or you just slept really well without having any worries. The answers might vary between person to person, but it's actually a cruel question to some people around the world. I want to share everyone a story. Once when we met a refugee online, the refugee looked really tired and distressed, and we wondered about what happened to her. We asked her about what happened, and this was what her answer was. Yesterday night, bombs landed in my town, and my husband's college died. You might not able to imagine that how sad and sorrow we were when we heard the pale voice describing about what everything happened to her. The experience brought her life into ours, and it's really making us feel so sad and so sorrow. And this is why we stand here today. A Taiwanese NGO co-founder, Zhang Xizhi, once told us this quote, "All humans are needed to be realized, because only realizing could we have the opportunity to change." This quote has never been more relevant to us. We need to understand about refugees until we can give a change to their lives. Mental health challenges have been a risk for those refugees due to the concern and the challenges they face during or after displacements. According to a research in 2024 made in Ethiopia, it showed out that 45% of these refugees had shown symptoms of depression, while 33.6% had shown symptoms of anxiety, and 37.3% had shown symptoms of PTSD. And another research paper had done on the reasons of why these refugees face PTSD or depression. And it showed out that these refugees are facing this situation exacerbated by the displacement of war. They're facing isolation of social and culture, and they don't know their situation. They might face a new family relationship, and they might have a new father or a new mother, and they don't have the opportunity for economics, and they don't have any support. And this is not just imagination for more than 108.4 million of people worldwide. They get into this situation due to war, political crisis, or any other reasons. And shockingly to say, over 40% of these people are children, standing for a large amount, and they don't even know where they are. And this is why we wanted to stand here today. In 2020, we founded Refugee Network Taiwan, hoping that every refugee children should have the opportunity to learn. We hope to send the opportunities for education from Taiwan to these refugee hosting countries, giving them a chance for basic education. Education is more than just learning. It's a tool of empowerment. It gives hope and gives survival and success. If these kids couldn't be taken care of or own education at a younger age, they will have far lesser opportunities for learning, working, and even living. And in order to survive, they might ignore their values that they believe only because they need to get alive. And furthermore, international security has become increasingly endangered, and it is getting into a devastating cycle. For those children who get an education and for those who didn't, have a large difference from those. If a children can get an education, they will have the opportunity and they will have the future lives, a better life, and they will have a stable life for their economic opportunities in the future. Our initiative, Refugee Network Taiwan, connects us with different refugees around the world. We believe that education can bring something different around the world, and we hope that we can bring education and foster dreams for these refugees someday in the future. In order to act our action, we first distinguished about the different places that these refugees distribute. We found out that these refugees are mostly at 4 countries, respectively Syria, Pakistan, Ukraine, and also South Sudan. And since we're a new organization, we chose Syria, the biggest country, to give out our education, giving out a distance for more than 7,834 kilometers for English online lessons. We want to address that we're not only just giving out English lessons, we're not just only basic literacy and numeracy, but also giving out English skills for these students. and hoping that they can use these English skills, and someday in the future, if they can move to another country, they will have the opportunity to earn a living. We believe that only by online lessons and only by English skills can they get an opportunity, can they live by working and live by any situation. In order to achieve our goal, we also did international interviews with different NGOs around the world in order to understand the multiple needs for refugees. We interviewed for 16 NGOs, and their interaction had made us connecting us with refugees and also put our mere ideas into practical strategies. An enlightening experience was the experience when we interviewed with Education Without Borders, which is another organization also working for education in refugees. Education Without Borders have different programs in Alpo University, serving for more than 1,800 students and providing tuition, living expenses, and also skill development. And by the cooperation with Education Without Borders, we give out these online lessons for these students, and they provide the online equipment for these students. And by the cooperation, we can teach refugees on a far distance, and we don't need to go so far away to help them by online lessons. In order to know more about refugees, we also interviewed about different organizations, learning about the social customs in Syria. We interviewed an organization called Little Middle East, and we know more about the Syrian subsistence cultures, the religious beliefs, and the education system. We also hope to know the situation happening in Syria after or during the war, and we wanted to learn more about education and learn more about their hopes. Our actions and solutions had connected us with refugees. We have been teaching more than 150 refugee students, facilitating for more than 130 Taiwanese teachers. Our teaching is not only just teaching English skills, we also hope to give them mental care and also giving them a better psychological well-being. And someday in the future, they can work someday in Europe or someday work in different countries. And we're not just giving these things to refugees. We also hope that we can give our actions and our solutions back to Taiwan. So before the lessons, we also have workshops for tutors, giving out lessons for Syrian customs, mental health, and also Syrian education. We wanted to give the tutors some things and making them and us more compassionate, understanding of the events that's happening around the world. And someday in the future, we can tell the world that Taiwan is a country that can also help refugees, although it is very far away, and Taiwan can help in any situation. And this is an integrated photo for us and different refugees, all getting their permission. Instead of just giving English lessons, we had made different mental health care, and everyone in the picture are looking quite happy and smiling. And we want to bring this power to the world. And also, we believe that we are bringing something back to ourselves and the society too. And someday in the future, these people could get more help, and we want to expand our opportunities to somewhere else in the future. In the photo underwards is a photo composed of our tutors and our organizations. We discussed about the different situations and the difficulties when we're facing different refugees. And by the discussion, we know more about refugees. And in the photo above, we had a lot of advocacies for our organizations to different NGOs and the government, hoping to give more support and get more funds in order to increase our ability. And we think that we are working on a way for a better future. Throughout our lessons, over 155 students were influenced, and with over 1,068 hours of teaching. We will not stop, and we will keep going on to work for refugees in the future. Our contribution is not only for Taiwan, but also for the global world. For Taiwan, we had more insights about refugees' rights and also broadened Taiwan's international perspectives. And also, we and our tutors had more understanding about these refugee education and its background, and we had made Taiwan more visible to the global society. And globally, we believe that global advocacy and global cooperation is really important to help more refugees. We strongly connect with different organizations around the world, and we hope that someday in the future, we can create a world with compassion and empathy, and every refugee would have the right to learn. So by the 20 minutes, you might ask a simple question. Like, everybody sitting here is from different fields of maybe medicine, maybe pharmacy, or maybe global public health, or maybe dentistry. Like, everybody sitting here are from fields of medical. Why am I standing here to talk so much about refugee education? What I want to say is that besides just bringing medical support, what's more important is that we can also bring hope and bring care to these refugees. And also, we're never too far or too young to change. So from today, maybe you can take a look or take more concern about these refugees' situation. And before we end, I want to tell everyone a story. Once when we met a refugee online, our volunteers quickly shared their dreams to each other and shared their future plans to each other. The refugee excitedly shared about his plan from moving from Turkey to Europe. And seeing his eagerness, our tutor asked more about the information. In the very first, we couldn't understand that why he decided to move alone without taking his family there. He said that due to the expensive costs and due to the dangerous routines, he decided to move there first alone. And after he settled down in Europe, he will bring his family there. For them, staying is dangerous, and so is leaving. No path is better. They need to justify the routine for themselves for a better way. And for us, in experience with war, our role isn't to judge or isn't to criticize their decision, but to practice more empathy, to listen more carefully, and to practice compassion to their lives. May our lives could learn these sufferings without having to endure it ourselves. In conclusion, behind every status is a human face. Every number means a life that could be changed by education, by compassion, or by policy. And together, we can create a world that everyone could own a great fortune and everyone could live better. Thank you all again for your attention, and thank you all again for this wonderful journey. Together, we can bring a world that everyone would have the opportunity for education, and everyone could live a life of dignity and purpose. Every refugee deserves an opportunity. Thank you.
Thank you, Mandy, for such a really lovely sharing. And I guess, we can all agree that it's fortunate to know there are so many people in the world, around the world, that cares about refugees, cares about the education, cares about the kids in conflict zones. We will have our panel discussion soon. So as my lovely colleagues, please help us rearrange the furniture. I would like to invite again our speakers for today to join in our panel discussion session later. First of all, I would like to thank you all again for, having you here and then sharing. It's really wonderful, and then leading us on such an inspirational path on the humanitarian scale. So we have definitely acquired many information how humanitarian aid has been distributed and what can we do more to help. So first of all, my question is, as for us, a future healthcare provider, and to both of the distinguished speakers here, you are the healthcare provider here. So how do we help to secure the safety of the healthcare workers who are now operating in the conflict zones if they are, unfortunately hurt or diseased? Or is there any challenges that we are now facing as healthcare workers in these conflict zones? I would like to ask the questions to all of you, so maybe.
Thank you. Yeah, I think there are many ethical considerations when it comes to healthcare workers in conflict zones, because there are lots of expectations on what healthcare professionals should do in conflict areas. It could be bioethical principles, it could be autonomy beneficence, it could be maleficence and justice. So many of these considerations need to be handled, and we need to educate. You mentioned education for refugees, but we also need to educate our healthcare workers so they are prepared to work in these emergencies or disasters or zones of war, etc. I think that's really important.
Actually, I'm not still a health worker now, and I'm just a student. So I'll just put my perspective about what I see or what I see in the past. So actually, a lot of health workers around the world, no matter Taiwan or no matter throughout the world, there are a lot of organizations working for like a humanitarian intervention in these situations or these countries around the world. And actually, I think that when we're always talking that these refugees are like in a harsh situation and harsh environment, actually I believe that when we're advocating for more medical, maybe people from medical field, and we can bring something back for these refugees. And because like maybe these countries are getting harsher and harsher, and just like what Dr. Mercy just mentioned, like nobody is respecting the law about these refugees, and so less and less people will want to face the danger of helping these refugees. But actually, I believe that only by advocating and only by letting the society know more about these refugee situation could help the situation that putting more people from medical field into these situations. And that is a way that we can help for more medical workers worldwide. Yeah, thank you.
Thank you so much. Just to add to that, that's really a very complex situation. As I said, it's fluid. And if you have one principle in place or strategy, it may not work. So I think one of the best things is, like I was talking to some of my students who were deployed as Army medics. So they said they used to go as a group, keep in touch with each other, and also, for whatever it's worth, have a white flag, but again, the white flag, unfortunately, can be covered with red. That is the blood. But actually, according to the Geneva Convention, which, as I said, and the fourth humanitarian law, which I just discussed briefly, it's not being observed, but we have to come up with what is there, like safety in numbers, and also try to keep in touch with your main base. Like if you're going there, like message your partner when you're going. And I don't think these safety things even just or these principles work in the war zone. I think for any of us, it's just tell somebody where you're going. It's not that Big Brother is watching you, as we would call it in the US, but it's always better to know. And what if somebody doesn't come back? And the one thing I would suggest is a satellite phone more than this phone, because at least you can track somebody. Because I know a lot of my former students who were in the Army, they say like, we used to have at least one satellite phone. So you know, you got to do what you can. Thank you.
Yes, can I just make a comment? I think that one of the most recent examples showcasing the need for collaboration between different healthcare workers in emergencies and disasters is actually the joint statement between several organizations in the World Health Professional Alliance, where we actually highly stated that it was regarding the conflict between Israel and Gaza, to respect the legal obligations under the international humanitarian law, and to protect and respect access to healthcare and to ensure the safety of civilians and healthcare workers. That was a joint statement between the World Health Professions Alliance, including 25 million healthcare workers in the world.
Thank you. Yes, that's true, but the problem is the accountability, as we were all saying before, in different ways in when we spoke, is not there. So it's great on paper, but the translation into practice, unfortunately, is failing many times. So when there are harsher punishments, when there's accountability, now why do we wear a seat belt? Because you get a fine. It hurts your pocket. We need to have something like that. Thank you so much.
Thank you all for inputting so many ideas here. I will make a really brief summary here, and then later on I'll take questions from the floor. Okay. So what we have heard is that this is a very important ethical questions, especially for us as healthcare or future healthcare workers, and education and having useful tools. Try to work in groups, and then after all, enter collaborations between different parties, different communities, different groups, NGOs, organizations, etc. will help as a medical worker or healthcare worker to help more refugees or help more people in need in the future, not only in the conflict zones, and I believe this will apply to all landscape, all environment. And as now on, I'd like to ask if there's any questions on the floor. All right, lady first.
Thanks. Hi, my name is Serena Cruz. I'm with Global Surgery Umbrella. One of the questions I have about galvanizing positive responses for peace in general from medics is the recent suggestion that the Geneva Declarations, the World Health Assembly, not the World Health, the World, the World Medical Association, there's been a call for it to be revised. And that revision, they're asking for it to be more inclusive. This is an area of advocacy that I would imagine medics could contribute to, specifically in cases of conflict. What do you all know about that suggestion for it to be revised, and what are your thoughts about that being revised?
No, I am actually not involved in that, so I actually can't answer, perhaps.
Actually, I just know about it, but a full disclosure, I'm not in any way involved with the WMA. But I think one of the things is it's also accountability, and definitely, like just to bring to everybody's notice, not that oh my God, she talks about the Pandemic Preparedness Treaty again. We're also talking about the IHR, excuse me, the International Health Regulations. So I think periodically all these need to be revised because we are living in such a dynamic world. What is good today may not be even good 1 month later. That being said, we cannot, it's not like you're changing your cell phone every time they put an advertisement out there. But what I'm trying to say is there needs to be a flexibility so that the processes for making changes is not so laborious, but it's practical and we can hit the ground running. But definitely, thank you for bringing that up. I think it's important. And I'm sure the stakeholders will do what they need to do. But again, the revision, as I said, we need to have these built-in processes. And that's why, along with monitoring and evaluation, it needs to be built in when you get into it. You cannot have your evaluation after your project is over. It needs to be at every step of the way. So even this is something like that. Thank you.
Question to the audience, if it's possible. We are sitting here as representing, you can say, different healthcare organizations, and you, the young students or pharmacists or doctors, etc., you are the future healthcare workers, and you are the ones that are going to work in disasters, in emergency zones, in wars, etc. What do you need from us today to make the future better for you when you have to go out to work in a disaster or emergency? That is important because we need to prepare the road forward for you. So what do you need from us?
So is there an, okay, addressing to the questions that Dr. Laws has asked.
Carry on. Okay. It's Dr. Jiang Guangyu from Taiwan and also a member of the World Medical Association. Thanks for Mr. Lars speaking. I think it's really fascinating. I found that the FIP has done an excellent job in maximizing the contribution of pharmacists to global peace work. However, in my experience as physician, I have observed that the clinical assistance work of pharmacists is limited by regulations, which also restrict their training. For example, in Taiwan, pharmacists are not authorized to administer vaccinations. Given the future trends toward a cross-field or cross-disciplinary collaboration and communication in various public health issues, do you support breaking these limitations?
Yeah, you're right. Regulatory changes are necessary to actually promote the pharmacist role and actually make it possible to work under new, you can say, new circumstances or prerequisites. However, I think that in a war zone or a disaster, even if it's not regulated, we have some kind of personal, you can say, conviction that we need to support people because that's why we choose in a healthcare career. But still, in some countries, when it comes, for example, to first aid, in many countries, pharmacies are actually perhaps the nearest healthcare center where you can approach in a disaster area. But due to legislation, you can also be fined if you actually commit an error, although with a good purpose. So it's not so easy, but I think we need to work on that. And actually, FIP is now having a project where we are identifying all over the world, where is pharmacy used as the first aid center in crisis or disaster zones. And we will see where are the gaps, what is possible, what is not possible. And based on that, we will continue to develop a statement or recommendations how to improve this. Because, as I said, we all need to collaborate when we have an emergency or a disaster. It's not possible for only one actor to solve the problems. Collaboration is key. It's collaboration, 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 I would say. So we will continue to work on that. And I will also ask our leadership, our CEO, to actually raise this collaborative work within the World Health Professions Alliance, as FIP this year is the chair for the alliance.
Yeah, that's fine. Yeah, just responding to the question just mentioned previously. I'm not really sure about the revision of different laws, but actually I'm really optimistic about every changes and every revisions in different laws because the law nowadays, the humanitarian different laws of humanitarian couldn't really help out those refugees or couldn't help out those wars or conflicts to happen. And last week, Israel just happened another maybe conflict, and it also didn't violate the laws for humanitarian law. And actually everything happening here is it's violating the law, but nobody cares. And actually, if we can revise the law, maybe making the punishment or making another situation that these politicians or maybe the the persons that causing these wars understand more about these situations, maybe that they will get they will lessly violate these laws, and maybe it'll create a better future. Maybe.
Yeah, I just wanted to add answer his question. Did you leave the room already before? Okay, so basically, just to add on to what my colleague said, it's teamwork. And also, I think we need to have some cross-disciplinary training, like, especially basics. Like, I think even pharmacists should know how to do basic CPR. So I think that's really crucial. If you're a healthcare, because you are healthcare professionals, because our nurses have to take it in the US, our PAs have to take it. So I really think, like you as especially, need to push this like CPR, which is life-saving. Because you can't say, oh, I'm a pharmacist, I can only give you your medication, but the patient is dying in front of you. No, that's the thing. You got to learn how to improvise and train. And before I hand it back, I've delivered babies using plastic bags because there were no gloves. You can't tell the baby, go back till I get my gloves. No. So that's the thing. You got to hit the ground running. But in order to hit the ground running, you need to have the tools. So I think you guys need to lobby, go register, because I'm always telling my students, go take the CPR course. You need to make sure you are trained in the basic CPR. Thank you.
Thank you. In many countries it's possible, but still it has to be improved. But I have a friend, he's a professor of pharmacy in Florida, and he's also working at one of the community pharmacies, and he says that to me that I am not allowed to do it due to my employer, because it's not according to the law, etc. So somehow we need to make sure that the regulatory authorities change the possibilities. Yeah, I know. Yeah, I know. Yeah. Yeah. Yes, yeah, you're right.
Thank you. It was really a fascinating panel discussion, but due to your limited time, I'm very sorry I have to call it off now. Thank you all again. And then I would like to make this very brief summary. I think that in today's first section of our event, I would say, first of all, we should all stay optimistic, no matter about the legislation revision or whatsoever. Staying optimistic as healthcare workers, as future healthcare workers, it is our job to stay optimistic and to try to look into all these problems, try to clarify where should we work on, what should we do, and then what we could work together. Collaboration, as Dr. Shudlin had said. And then thank you all for joining in our first section. Let me pass my floor to the Alina, who is our host today.
Thank you, Jean. And now let's proceed with the awarding of the certificate. It's my pleasure to invite Walter, the delegate of Taiwan Healthcare Use Alliance for WHA, to present the certificate of appreciation. Thanks, speakers and Walter. We will take a photo. We will take a photo with the participants here in the front of the, So please Again, Alina. I hope you have a refreshing break and are ready for the next section of our event entitled Youth Empowerment in Global Health, Strategies and Initiative and Impact. Let's welcome moderator Celine for the next part of the event.
Thank you, Alina. So hi, everyone. I'm Celine. I'm the moderator for the second part of the event. So today we will be focusing on the topic of youth empowerment and youth engagement. Young people are at the forefront of innovative health solutions and advocacy, and their engagement is crucial for sustainable and impactful health initiatives. Youth empowerment and engagement in health initiatives bring a multitude of benefits that are essential for driving progress and fostering resilience in communities. Youth engagement also plays a pivotal role in community mobilization. Young people often act as the connectors within their communities, bridging gaps between different groups and fostering a collaborative approach to health challenges. Their ability to mobilize peers and community members can lead to more effective health campaigns and greater community participation in health programs. Today, we have an impressive panel of speakers lined up who will share their experiences on this topic. These distinguished individuals have made significant contributions to public health and youth empowerment. Without further ado, allow me to introduce you our first speaker for today, Dr. Po-Chin Lee. He is currently a student at London School of Economics and Political Science and a distinguished Chevening Scholar funded by the UK Foreign, Commonwealth and Development Office. Before embarking on his master's degree in London, Dr. Lee graduated from National Cheng Kung University Medical School in Taiwan in 2021. Dr. Lee has been a passionate advocate for health diplomacy and youth empowerment, taking on various international and domestic roles, including serving as the president of the International Federation of Medical Students Association, IFMSA, and also the president of the Federation of Medical Students in Taiwan. Starting in June 2024, he will begin his research affiliation at the UK Department of Health and Social Care. His research interests encompass global health security, health in all policies, disaster medicine, and the political economy of health. Today, he will be enlightening us about youth international affairs in geopolitical dynamics, challenges in the pre-pandemic era. Ladies and gentlemen, please join me in welcoming Dr. Po-Chin Lee.
Thank you. I wrote that introduction myself, but hearing from others' mouths, feel flattered as well. So thank you for inviting me and hosting me in a very comfortable way. Two things before we start. First, thank you, because I think tomorrow and Saturday are the two last working days. So you must be very tired already, reading too many words, listen to many performances and sharings of the relatively elder generations of their life careers, make you a bit conscious or a bit nervous about where you are going or not. But that's, remember one thing very simple, that you are mostly students. You're putting off your academic work. Some of you might have exams like me tomorrow or next week. So feel free to study if you really need so, but I won't be disturbed by that. But thank you for your commitment that traveling from Taiwan and many other places in the world, that opportunistic cost is very high. And when I said that opportunistic cost, you know, I study a bit in economies and the political analysis. So that's the tone for me. And why I'm choosing that tone in this occasion is I believe shortly in a few days we're leaving Geneva. We're getting out of these beautiful, hopeful bubbles jointly created by people that believe health should be prioritized in our world. That bubble is way too big in Geneva for now, and it will be destroyed in a couple of days. In reality, health is not usually prioritized. But I was saying that the world is disappointing us prioritizing health in their agenda. Not necessarily, but that requires us to critically assess this topic. So as you can see, I'm not much older than you, if that's possible that you can tell. Let's do it in a more academic way, systematically assess what you probably have heard in the past few days. That could be more helpful for you as a part-time global health advocate and hopefully full-time students and full-time future healthcare workers. Lovely. I don't know what happened. Okay, so no, I don't want it. Okay, so here I want you to focus first. I put pre-pandemic era because I personally believe that we're actually already shifted from post-pandemic to pre-pandemic already. Our focus and our enthusiasms on pandemic has elapsed, but we will talk more about that later. I think I'll just go with that. Okay, this is a graphic produced by WHO in early SDG era. They map the connections between SDG 3, which is focused on health, to all the other SDG that exists in the UN system. From this graphic, we generate a concept called health in all policies, that everything is related to health. And you cannot focus without health and achieve all the rest topics, even not health related. But we think reversely, health in all policy means health can contribute to other industries and other factors of the policies, vice versa. All the other policies is actually connected to health. For example, some of you are studying pharmaceutical studies. You know how intellectual properties and how the pricing settings, political negotiation have huge impacts on general access to medicine. That's just a small example of that. So when we said health policies, it is not specifically something about health, although this week in WHO it feels like that. Health policy is not just about health. Health policy is about law. Health policy is about finance. Health policy is about trading, climate, industry, semiconductor, and geopolitics. And our topic is health diplomacy. I want to reinforce your opinion again that diplomacy is an extension of policies. You cannot do diplomacy without a policy at home. So for countries like US, UK, they could spend their time talking about health, negotiating about pandemic accord, but that's mostly based on their domestic policies outside health. How they interact with developing countries, how they deal with their international relations, what they see about intellectual properties of health, facilities, and pharmaceutics. So that's a key thing that you should bear in mind before we continue. Great. Seems like we only have one slide possible. Okay, great. Okay, next page. Okay, so this is a term I think you are all very familiar with. Evidence-based medicine. So medical students here, tell me what is evidence-based medicine? Okay, no one wants to answer. You don't care about what is evidence-based medicine because it's quite self-explanatory. But there's one gold standard that you must be familiar with. What is the gold standard of evidence-based medicine? Randomized, control, trial. This RCT, yes, thank you. RCT is the gold standard in evidence-based medicine. That applies to evidence-based policy as well. So we expect that policies are formed on the basis of evidence, research evidence, economic evidence, whatever they are. But we're starting to be faced with some challenges as well. Why? Because the best example we can see is during COVID, when we're promoting vaccination policies. We start to encounter well-founded fallacies and well-founded false informations. Our overemphasis on evidence-based policy motivates those people that go against our general understanding to frame their statement in an evidence-based approach. So they can produce their own research, come up with very weird conclusions, inappropriate methodologies, whatever they come up, they frame it like it's evidence-based. So for example, we have a long discussion on whether children should also get vaccinated. That's evidence limited because we don't have kids in the past being vaccinated with COVID vaccines. So they use it as a weapon to tell the Ministry of Health worldwide that putting kids on the list of COVID vaccines is a not evidence-based approach and not jeopardize the politics, leaderships, and the power of the government. when I say power, we need to also be aware that diplomacy itself is an extension of political things. And power to the political analysis is like economy to economics. That's important. I think there are two following speakers. They will tell you some real-world examples and what they do. Make sure you start to analyze where is the power, who have the power in those diplomacy arena that can better guide you and navigate you to the contents of what we're discussing. This umbrella, very cute. I hope you have seen that multiple times in the past week. This is for universal health coverage. And the concept of universal health coverage is in simple way, everything for everyone at an affordable price. That's coverage, breadth. Breadth means how many people we are covering. And at affordable price means financial protections. But if you have watched a video or movie called Everything, Everywhere, All at Once, that means something is going wrong. So if we really have everything for everyone at an affordable price, that means something could easily go wrong in the real world health systems. Another thing we need to be aware is that this is an idealistic way of the health system, but do we really want that? Do we really want everything for everyone at an affordable price in a general way? Could that cause efficiency loss? Could that be a wasteful approach? Would it be actually discriminating specific group of people in the health systems? So that's also a discussion. And that's a value decision. That is not evidence. Evidence tells us that health coverage for everyone is good, but that's not enough. We need to make that value decision in our government or by you, future healthcare students and workers, if we really want that in your country, in your community, in your healthcare system. So, like I said, health is a concept that is universally recognized, but this concept is not universally aligned. Everyone has different understanding to health. What is health? What is unhealth or unhealthy? So that's a decision, that's a value-based thing that is not able to be proved by the evidence. So evidence-based policy has its limits, and we should be aware of that when we're doing diplomacy work and where political wills often intervene and has its own interests. Health and diplomacy, what we have seen in these past few days, there are some limits. And of course, we hope eventually it's health and diplomacy. But in real world, it's very likely that health is just an excuse for countries to unite. And we shift from health to economics, from industrial growth. We will start to discuss something else, and that's kind of unfortunate, but we need to live with that. You are doing international affairs. You are not necessarily doing diplomacy. Diplomacy is a very intricate process, often related to governments, but not always. So it is important for healthcare professionals to identify if you are doing international affairs, like internationalize your research, internationalize your connections, internationalize your visibilities. And that's different from diplomacy work, even in health. That's a philosophical issue. I will leave it to some other PhD that I'm not yet. So we would have just a short glimpse on that. So very often time, even in the earlier session, we keep being disappointed by what the world really is. So the question is global governance of health failing? We can't even pass an accord right after the pandemic. That's disappointing. But is it failing? Like, although we are being optimistic, although we try to believe what's being believed, is it failing? There are thousands of issues happening in the same time that we try to achieve, or we can't, or it's being compromised. But kids, that's diplomacy, and you have to live with that. I said that we're defining this moment not as post-pandemic era, because in your understanding, post-pandemic era, the whole world is very focused on these four issues. Surveillance, response, preparedness, the capacity building for pandemic, supply chain resilience, benefit sharings. These are two topics, more of a trade or international cooperation on intellectual properties, and that falls under World Trade Organization, kind of beyond WHO's capabilities and areas of work of that. Lastly, we want the whole system to be equity and inclusiveness. They even have specific articles in proposed draft for pandemic agreement, and unfortunately was not adopted at the end. And now we're in a pre-pandemic era when countries are start to feel like, okay, we're fine, we survived COVID. If we can survive it once, we can survive it again. So if it comes again, it's fine if we don't have a new approach yet, because the existing mechanisms works for us. So that's how health security and the 4 small bubbles that you see in the previous page become very marginalized. And we have to recognize that if we postpone 1 more year for the pandemic accord negotiation in WHO, that enthusiasm will just keep decreasing, and that's not beneficial from my point of view at all to be beneficial for reaching more agreement or consensus on what we want to have in that agreement. I told you that this is a common question that have been raised, but we also need to think about, is the global governance of health more defeated than in the past? Or we also need to know, is global governance of trade failing? Global governance of climate change failing? Well, actually, no. Or at least global governance of health is not failing alone. The whole multilateralism is actually challenged very oftenly. That's something that I want to address your attention, hopefully in the last couple of minutes, if I'm not exceeding the time yet. The geopolitical dynamics has always been there, but it was more addressed since COVID because of the coincidence of US-China conflicts, many of the discussions, and Taiwan, Israel, and all the other regions that have their issues in the meantime. Well, a pandemic enlarged the problems in our society. It doesn't create new problems. It enlarged and amplified our attention to them. So that's why we somehow feel that the pandemic is a tough period, because the pandemic forces us to review all the problems and deficits in our current system. So that's very fair. We also notice the global governance is not confident, believed by the world. People are challenging, or people are questioning the integrity, the neutralities of WHO in this world. So there are actually some more way that shifting from global governance to regional agenda. And that doesn't only happen in health areas. People from Taiwan's or Pacific areas, you must be very familiar with a FTA called CPTPP. CPTPP is a free trade agreement negotiated between several countries. This kind of regional cooperation, or in the modern form of regional cooperation, compared to the past way of a regional organization like European Union or APEC or ASEAN or African Union, is more flexible, and I would say is more trust-based. Because only if you trust your counterpart in trade or economic benefits will you have trust in them when dealing with sensitive issues like health and climate. So that's a new trend of it. So lastly, I want to share with you, also listen to your sharing, what youth can do in this new era or new way of diplomacy is being proposed. This is Asia Pacific. I was the director of Asia Pacific in FMSA before my presidency. Now if you throw 2 darts randomly on this map, 99% the locations will have conflicts in between, even if they're in the same countries. So this is a very sensitive places, and political conflicts, regional differences, language issues, communisms, vs. liberalisms, all of the issues. Luckily, we don't have a war yet, but we don't know how far we are from that. And the geopolitics has a huge focus in this area. I want to propose or raise a question to you. Can we have the next? No, the next. Okay, I'll just do it verbally. My predecessors, when they're doing international organization activity, they try to be non-political. They claim themselves to be non-political so they can focus on evidence and science and values. But then we soon find that that's quite impossible, because if you're doing policy advocacy, if you're doing connection with governments or international organizations, that's political. So when we start to switch that phrasing or framing from non-political to non-partisan. Okay, so that's slightly different. But now we're seeing that that non-partisan is no longer existing. Take the issue in Gaza, for example. youth people might post an Instagram, all eyes on Rafale. You believe that's an action showing that you are solidarity with the challenged people, unhumanly treated people. You are not necessarily supporting Palestine, or you're not necessarily supporting Hamas. You're not necessarily Arabic world, or you're not necessarily going against Israel or Jewish people. That's very often time our own interpretation of our own actions in the international platforms. You think that's nonpartisan. You think that's purely based on your values, but we have to think from the government side. Governments make similar wording in their statements in WHO, in the UN, because diplomacy is a science or is an action that requires further interpretations. And all those interpretations are based on hypotheses or indirect reasoning, connection of the words. So that's why I said that nonpartisan nowadays could no longer be easily addressed by youth people. If you think you are nonpartisan, people interpret your actions, your words in a different way. So that's something that you need to be very aware of. And what we can do is that I think the international organization nowadays should start to address geopolitical issues. We don't get away from it. The failure of WHO's negotiation in pandemic accord partially is because they want to avoid all the sensitive political topics, or they don't want to address issues in Taiwan. They don't want to address the huge fact that developed countries and low and middle income countries has a political-based long-term inequities. That's not health. That's out of their scope. So they try to avoid that, try to reach a consensus so we can at least have something. But the facts tell us multiple times, not just with the pandemic agreements, if you don't address geopolitics issues, especially after COVID period or the post-pandemic period, it is very unlikely that you reach any global consensus or global agreement on simply anything. So youth people, especially those from Taiwan or East Europe, Middle East, you are in the center of geopolitical reality. You should bring that knowledge and expertise to your international organizations, telling them why geopolitics is not avoidable. And you should bring that statement to help your organizations know, at least they are not really addressing it or choosing a side on it. They need to be aware that avoid talking those issues, it's harmful. And if we still believe in multilateralism or social connections of international organizations to WHO or UN systems, non-state actors or international civil societies will be the only possible starts that we can promote those global agencies or regional agencies to bring the countries forward, regardless of the conflicts in between. So that's my wishes for you. You are young, your career is promising, and you're energetic despite of the entire week of work. I see the possibilities in you. So good luck, and thank you again for your efforts and your belief in global health governance could be possible. This session, or my short speech, a bit lengthy, is want to remind you that health issues cannot be addressed only via health perspective or health approach. It contains political issues. It contains economic, legal approach to reframe the topics that we are seeing. And that requires you to make friends outside the hospital or medical schools so you can talk about the same issues on that. And thank you very much. If you have questions, I believe we'll have time to deal with that afterwards. And I'll pass that to Alessandro and, of course, the mediators.
Thank you, Dr. Po-Chin Lee, for an insightful and inspiring presentation. So let's not forget what Dr. Po-Chin Lee taught us, and let's know how important it is to have policy insight, not only looking at the healthcare perspectives. So before, I just received a message that Dr. Murthy is leaving for a conference, and she wants to share with us some inspiring message. Can we have Dr. Murthy?
Thank you so much. First of all, I think you did a great job. And I'm so sorry I'm missing your talk because I can't clone myself, you know. AI is still, because I have to be at some. Just wanted to add one more thing to all of you here is what you're all doing is soft global diplomacy. So that is when you're talking about a global diplomacy. It's not that my delegation came, some of my American colleagues from the State Department, but it's whatever we do. When we're doing something with the local action, which translates globally, that's soft diplomacy. So that's what you guys also need to focus on. Yeah, your talk was good. I'm so sorry I can't stay for all. As I said, I would love to, but I got to go back to the Palais. So good luck. And, anytime you guys want, you have my email, contact me. Thank you again. Bye-bye.
Thank you, Dr. Murthy. Okay, so next up, we have a distinguished speaker who wears multiple hats in the field of public health. He plays a pivotal role as the chair of the Young World Federation of Public Health Associations, spearheading various research, advocacy, and educational initiatives. So he is also a medical student specializing in public health at Vita Salute San Raffaele University in Milan. So he also serves as the consultant at WHO Europe and stationed in the WHO Athens Office of Quality of Care and Patient Safety. Driven by a passion for improving healthcare systems and patient outcomes, he focuses on areas such as quality of care, care integration, healthcare workforce, and digital health. His extensive experience includes contributing to international projects at the Italian National Institute of Health and providing invaluable insights as a junior healthcare consultant at GSD. Notably, during the pandemic, he actively contributed as a medical doctor supporting infectious disease prevention and vaccination efforts. Ladies and gentlemen, please join me in extending a warm welcome to Dr. Alessandro Barioni.
Two kind introductions. Thank you, Celine. Thank you for the invitation to the Taiwan Federation of Public Health Student Association. Wait, I'm trying to get acquainted with that. Thank you for the previous speakers, to the chairs. I'm really happy to be here today. And I think we've been through lots of very interesting presentations. So I really like when you were speaking about the non-partisan, the building trust, the trust discussion, and also the intercollaboration that were mentioned before, and also the root cause analysis addressing global health diplomacy. I think we are the first one that can, start this message with the soft diplomacy approach that the first speakers just mentioned before. So these are the main points that I've outlined for today. Sorry for the not original title. It's just I would like to address the youth engagement and the activities that we've been doing with the young WFPHA. I know it's difficult to spell out. You need to practice a bit. That's what I do every day in the morning. But yeah, this is the list. So trying to give a very quick introduction on what I see as global health diplomacy and what is our roles as youth, presenting what are our activities in this topic. Actually, we have been discussing with Bettina Borish, our executive director, about the relevance of youth engagement and youth activities, youth community in but trying to push forward and address the issues that are coming up during these days in the international scenario, wars, earthquakes. So we are the first one that maybe can address this problem. And finally, some tailored action that we're trying to push forward. And I kind of say, urge you to join Young WFPHA to try to fix these things together. Is so a call to action. But I will say, let's see if it does it move. Okay. So I want to start from this. This is a personal story of mine. It was June 2023. These are my friends that I met in Greece when I just moved there in Athens. And here you can find Laura, Lexi, and Yaya. We met, we were having a lot of fun. I left Greece and I came back to Greece and I was just checking social media some months later. It was November 2023. And when I was scrolling my Instagram, out of nowhere, I was seeing this picture. And there was written under me with my brother in Gaza Beach. And I started looking at my friend's profile. Oh, sorry. And I noticed that he lost like 8 brothers and sisters in the Gaza Strip. So I got shocked and I started talking with him. But I didn't even know how to, it's difficult to communicate with a person that has lost almost all his family. And the worst thing is that you got used to that. So I'm sorry to mention this thing, but I think that we all need to be aware of what is going on. And I think getting a bit emotional on these things because sometimes we need to use this powerful message, because science sometimes is too hard, and we need to keep the emotional part of ourselves to understand that our first priority for global health diplomacy is peace, is the substrate we all need to build on top of. And I think this is really relevant, and I also urge you again, let's try to use these powerful messages. Data and evidence-based policy medicine is great, but we need to put also some other means to make it sound, addressing, and straight to the point for people. So, as you can see, the trend for death-related, war-related deaths is increasing intra-countries or inter-regional. So things are going worsening, and we need to fix that. We need to find a way to make the curve going the other way. This is the global scenario I took from the website. I don't remember our world in data. yeah, thank you. And this is the definition that I like to give about global health diplomacy that I found online as well. So I like that health can be a mean to put together, you see, peace and development. And we have the power, since we're discussing about health, to use health as a driver. So we can communicate peace-building negotiations through the health. And that's why I think it's really relevant for us to discuss about global health diplomacy. This is a nice pyramid that is really, I think, interesting for the thing you've just discussed. I mean, I think we are part of the informal health diplomacies. The first speaker was saying just the soft one. It doesn't mean it's not relevant. I think this creates the substrate for the multi-stakeholder health diplomacy and for the core health. Of course, we are not member states, but we can change things step by step and change the background, the culture. It takes time. It's not one day after the other, but it can really drive something changing, let's say. So, why youth voices are important for that? I've been questioning this for a lot of time, and I was like, I think we are doing something great, but I see the vision, but sometimes it's like, why is that? So these are the answers that I gave to myself, and I want to hear also your feedback about this later. So I think we are like, have a sense of global citizenship. I don't know if you believe that, but everyone feels like we are all sons of the same planet, we belong all together, and this is something that's most common with young people. At the same time, we are very interconnected through social media, whatever, you know. Everyone can talk the same language today. We are almost all English speakers, and also we have innovative perspective that can be, you know, having ideas to address things through digital technology, chat GPTs, tailored chat GPTs, and sometimes the senior says, oh, that's amazing, but we're not involved in discussions, you know. So I think these are the main reasons. But I want to address all the things that we have been doing with Young WFPHA, and want to hear your feedback and maybe join the activities. And I'm showing off what are the impact that we have achieved so far, and showing off that what are the future activities that we're planning for the following months. And yeah, the open call again. So quickly, I'll be introducing Young WFPHA. This is the picture that we made last year during international students and young professional meetings on public health, too long. It's called ISMOF 2023. The next one will be in Cape Town. But as you can see, there are so many people from so many countries, and we have created a very strong youth community in public health. I don't know if you know World Federation of Public Health Association, but it's an international federation that represents over 5 million of public health professionals across the world, and that's more than 130 members. So we are trying to create something strong, especially for young people. This is the vision that we have, with whom we started this thing. The idea started back to Berlin 2022, where we noticed that Europe is really strong with young aggregation, but other regions and worldwide is even more difficult because of time zone, geographical constraints. But this is the vision. I know it's ambitious, but we want to achieve that, and I think FMSA and other associations are excelling on that. So we ask also their help on that, but not only in the medical perspective, but in the public health, because it's all over embracing. And that's what we would like to, you know, achieve. Empowering, engaging, and aggregating students and early career professionals to achieve international collaboration and shared decision making so we can have an impact. These are the goals: promoting opportunities and facilitating the exchange of knowledge. we are mainly working on leadership, professional development, youth engagement, new collaborations, especially health and non-health related, and also working a lot with health communication. I will show something later, and advancing evidence in public health. So evidence-based public health, just resonate with, with a colleague. These are definition of membership. It's pretty wide, so we want everyone on board, but we want an early career. So it's early career definition, students and young professionals. More than 1,000 members in more than 80 countries. The idea is to keep expanding and to have regular membership meetings. This is the first survey that we have had with Young WFPHA, and these are the countries that we are covering so far. As you can see, Europe. So this is one of the main problems. You see, oh, Europe is doing well. Yeah, but what is not Europe? So that's why we're pushing you and everyone to join that. Mostly medical doctors, another problem of non-medical view engaged. And I mean by that, we need healthcare professionals, all of them, and non-health professionals. So we are working towards, yeah, this is the graph, sorry, I made confusion. We also need other people. As for the engagement, this is our main strategy, so pushing people to be more motivated, to have sense of individual responsibility, because all of you is a drop in the ocean that resonate with others. And we want to communicate effectively that, because people need that. The individual responsibility and acting as a model is something that we need to do that. This is the overview, quick, of all the activities we've done so far. So currently I have this thing, this is fancy, okay. We have done this survey that we're about to publish. We're working a lot on AMR with several organizations as well. And this is the review that we are running right now. But there are so many other research projects that are ongoing. And I also ask you if you want to join or propose some other research project. We are pretty open to connect you with supervisor or wherever you want. Yes. That's what we want, engagement, and propose people to get on board. So other activities, ISMOV, this is an in-person event in Rome. Lots of people engage, especially for the social events. And this is our team. There are 18 people working hard on these several research, regional representativeness, admin, activities, project management, and coordination. So many webinars as well. This is the overview. As you can see, I'll move this quickly just to give an overview of that. This is the review that we're finishing. 88 articles that we have achieved with the full text screening, and these are the preliminary results. Education, this is something really interesting, especially on point of diplomacy, because I came back to that. We want to enhance the capacity building for early career professional. And this is the main point that we want to focus on. That's why I think it's relevant, especially being here today and talking about negotiation skills and peace building. We are in contact with many people with the emergency preparedness, with the former Minister of Health, and we want to set up a machine for capacity building on these topics. Negotiations and diplomacy. Other events, just to show off social determinants of health, and we also had many activities during the Global Public Health Week. The most interesting one was the last one, where we talk a lot about diplomacy, and that was relevant to empower the future professionals for this topic. To talk about diplomacy again, in the communication, we would like to start, we have started this Young WFPHA Health Hub. This is the one, and we are trying to ask people for reels, to send us reels. This is something we will do soon, and especially relevant to diplomacy. This is the team, and yeah, I will go fast on that. Okay, this is the timeline that we are planning. But please feel free to, if you're any interested in TikTok or you're good in content creation, please reach us out, because we desperately need people that want to create and content. And I'm not Gen Z, so yeah, it's my fault, I know. But if you're Gen Alpha, even better. So, okay. Also want to propose internship and mentorship, and these are other external collaboration we've had so far with AMR, Quadripartite Alliance, and yeah, these are other activities we are planning. WHO roadmap, and this is the event we have had. Sorry for over-speaking about this. Okay, now I come to the relevant point. If you want to have a quick break, it's 15 minutes I've been speaking. I guess someone of you needs any break. 1 minute to stand up and sit down. If you want to do it, you're free. Okay. At least you have some time to breathe. So, this is one of our main priorities. And during these days, we've been discussing with all their organizations, Katya from the Youth Health Organization and WHO Youth Council. We have a representative over there in the back of the room that is hiding. And so why this is important? As I was saying, Europe is overrepresented with so many association organizations. But the rest, for example, Southeast Asia, have 1-2 that we're in contact with, and it's so difficult to get in touch with the rest. So we would like to push on that and not only strengthen the regional, the inter-regional, but also the national one, and facilitate the equitable approach. I mean, some countries have economical issues compared to, Europe. So we're trying to engage with them and to push them in, because sometimes, some countries are overrepresented, but they have more difficulties because they cannot work voluntarily as maybe I can do for WFPHA. This is a problem we need to solve. It takes funds, money, I know. It's not easy, it takes time, but we need to be aware of that, especially in terms of diplomacy and equity, in the representativity. So, we started with this networking event last year in October. We had this general interregional session for everyone to network, and we are starting with regional networking session. This is a starting that we want to do. But from that onwards, we started with several events. This is in Europe. We have participated in several events like this one during European Public Health Week, European Conference, European Public Health Week in 2024. This is 2023. The Youth for Health launch in September. So, again, Europe is pretty active. But the Eastern Mediterranean region is going pretty well right now, and we have our appointed for the EMRO Youth Council. That's Dua Shella, that has just been appointed for the vice chair of the steering committee of the Youth Council. But we want all the other regions to be part of, and at the same way active. We are discussing with the American region, and we're trying to push the same. We are in contact with this association, but we want to do the same for the African region, especially given that we'll be hosting the conference in Cape Town in 2026. Free to join if you want. And then for the Western Pacific. So I hope today this event can be like something that can launch, this discussion. And I was talking with Walter before. We have many representatives representatives from Australia, New Zealand, Southeast Asia, Japan. We need to put everyone together. Everyone, and start discussing about this, and now we can propose that. So this again, urging you all together to do something like, I was saying a regional event together. Let's do that. It can be online, and we can discuss what are the priorities for the region. Same for Southeast Asia. Still a bit struggling, but we can contact also the appointed people for the several offices. So, how much time have I left? Is still there? 5 minutes. 6 minutes. 15. Okay, I have time. Okay. I've been rushing. It's always acting like that. Okay. So, what is our strategy, especially for global health diplomacy? I will go more into detail after presenting the Young WFPHA. The main thing, we want you. I know it's a bit, scaring maybe. I feel, it's rejection. But anyway, let me start by that. With this, we have, it was like in November, we had this communication workshop with WHO, and it was on how to communicate effectively with people. And I think we need to be aware of that. Diplomacy is really a lot about communication. So she started saying, when you communicate, you need to find a way. She gave us a framework. And we were there. I never attended to a communication actual event. She started saying, you always need to have a story to drive your, to deliver, your concepts. And you need to be always aware of these three things. What do you want your audience to know? How do you want your audience to feel? And what do you expect your audience to do? And I think this is really, mind-blowing, because you are not always thinking about that. We're just putting together slides, as I did for my Young WFPHA presentation. Sorry for showing off. But think about, I've thought about it. The most I would show you what I would like you to know, feel, and do. Oh, there's a repetition, sorry. So what about the no answer? I think many people repeated that today. So this is not entirely new, but we've said that we can be a youth community, can drive change, can bridge together different culture, different wars, and we are against the clashes. We are all together. We want to have unity, not division, as some people would like. That's what we are fighting, I think. We have amazing skills, digital skills, even just posting on social media. We have that. Just be aware and leverage on that, on top of that. And also we are able to engage, interact with non-health stakeholders. We have innovative perspectives, as I was saying before. So this is one point that I want to discuss regarding the non-health participation. So one of our projects and ideas is to go to the Summit of the Future, have a side event. So there's a proposal also for FMSA, and let's assess all the non-health related professionals. So how can we put together people from design, people from architecture, people from law, people from agricultural field? We need to be all together. And then I would like to propose what I call health in all workforces. Like putting the health as a framework or as a point to highlight in all the workforces, because everyone needs to be, I think, aware of that. That's what all we are pointing at, even if sometimes we're not that much aware of it. So, and another thing that I would like you to know is about how can we develop cultural sensitivity. So these are the points that we need to be aware and also develop as future communicator in the diplomat scene. I really like this one. I found it online. I don't know if it's World Bank. I don't think so. But, you know, the multicultural and intercultural view is a process. I think we can, as a young people, we are more keen going that way, but we need to push people to push them upwards. So from denial, polarization, minimization, acceptance, and adaptation. And I had a really interesting conversation with a colleague a few days ago. Actually, it was really disappointing because we were discussing about accepting some new trends of binary, non-binary. And I think that it was kind of at the step of minimization or polarization. So I wanted, I was expecting from him something different. But I think it takes time to get there. We can bring together some communication tips and some ideas or some background that we know we want to deliver, especially for the global health diplomacy and for this discrimination or intercultural things. And that's why I think we should develop more the engagement and communication competencies. This is the framework that's been developed by WHO for the competencies for the UHC. There is a new one that has been published 2 days ago, so super new, that is on public health emergency roadmap, a workforce roadmap. So also go looking at the other one. That's from the Healthcare Workforce Division. We have collaborated as a young WFPHA. But let's try to put together ideas. Let's try to connect with the WHO Academy, WHO Healthcare Workforce, and what are the courses or the things that we would like to propose for empowering communication. So before this question, wait, I will come to that. I have another one. How many of you have already attended to any communication course so far? Like on an engaging, we have one. We have one. No one, you see? 2, 3. Don't be shy. That's 3.5. But you see, as I was saying before, we are not aware sometimes on how to deliver the concept. And this is something really important. I hope I'm doing not good, but decent. But the point is, there was this workshop where they told us, it was really mind-blowing because they were saying 90% of what you show gets stick on people's mind. So I have an impact. When we are speaking, if we don't show anything, there is like a really tiny percentage of what gets into people's mind. So we have means. We need just to be aware of that and leverage on that. So visual, so arts, technology, disruptive tools that we can use because we know how to do that. I asked ChatGPT to do some random pictures, and they created some, I forgot to put here, I'm really sorry, but some pictures to, discourage people on smoking, and some other picture to encourage people on healthy lifestyles and behaviors, and they did great. But, innovative perspectives, creative, artistical ones, we can do that. Then, second point. I guess there are 8 minutes, how many? Okay, almost. I have time. How many of you feel inspired by what you're doing, public health? What's the thing that moves you, the ikigai in the Japanese philosophy, We have 1, 2, come on, only 3 people are inspired. Don't be shy, we're not reporting to anyone. Okay, I expected more. I have a question. Why you don't feel inspired for those that didn't raise their hands? You can reply. Go.
In the beginning of my journey in public health, I wasn't inspired because I had very few impacts, and I couldn't tell actually if I was being listened and how I could reach out and make a difference.
This is really interesting. And I think that sometimes it's about showing a way that we can be really impactful. And that's why I also talked before about the individual responsibility and try to motivate people. And I think Young FPHSATW, all the other international youth engagement platforms can prove you that. And actually, now that you're active in the Euronet or the World Bank, you see that things can be done. But you need to take part of the things and the associations. So that's another point for the platform, these playgrounds platforms that allows you to work and join. So again, I think this is the answer. Try to, I will explain that. I saw you were confused. So I put the butterfly effect, the one, you just do something tiny that resonates with other people, that moves something. So just keep doing small things because we are having an impact. Even though we don't see the final effect, final outcome, or the snowball, it takes time, but we will get. So that's why we keep pushing and be motivated, stay positive. And I think that the second or third speakers also mentioned that we need to keep this attitude because even though if it's not our outcomes, it's not our results, the sense of community results is achieved. And this is something that needs to be kept, the sense of trust in the community that I think is spreading at the moment, given this, there's a lot of individualism. But anyway, other question, and then we're almost done. What are your ideas on how we can enhance global diplomacy and how we can include more youth in general, young professionals? Again, feel free to say something if you have any idea. I have a reply, but I want to hear from you. What are the main issues and samples?
In my opinion, just like holding this event, we can exchange our thoughts and opinions with us. Because sometimes we only use virtually meetings, and we can observe later face in the very details. But we have this event, we can know each other what they think, and it is many ways to make health diplomacies in our youth engagement, and especially in the international affairs. It is hard to know each other's cultures, but when we have a opportunity to speak with us in this small talk, and we can know more each others as well. So that's my opinion. Thanks.
Okay. Then I go ahead. Otherwise, I'm afraid that they will. No. Go. Okay.
I think an important thing to do while engaging youth is to, at the same time, help or, teach them or open their minds to thinking out of the box.
Yeah.
And when you think you're out of the box, think of out of that box. You're always in a box.
Yeah, of course.
So we tend as humans to delude ourselves into believing that we are out of the box. Well, we're not Does that make sense for us?
Yeah. It makes sense. And I think that the best way is to, keep engaging with several cultures and different, people, because this allows you to always have new ideas, new things. So keep engaging, keep discussing with people, keep being part of association things. This is really good. Don't be overwhelmed, because the burnout is around the corner. I'm kidding. But I think it's really important to keep engaging. Being here today to meet so many people as you can. And so, yeah, this is what I would like you to do, if possible. This is, as I was saying, again, a call to action. We are a pretty flexible and open platform. We want people to join, to propose activities, research, to join to research, communication, engagement, networking, internship. We have several activities and framework that we're trying to push forward. We started 1 year ago, and I think even though we need to finalize some structures, I think we're doing lots of things together. Many people are so enthusiastic, have energy on what we're doing. So it can be something local or global. We have the means, but we need people to work on, I see the potential match between the two things. And finally, I urge you again to act as a model. You have something you can change, do that tiny thing that can impact your society or community in general. And that was called I was reading a book on philosophy, Japanese philosophy that's referred to omoyari, to something tiny that can change the philosophy. It is for us to say, we can choose which path we want to go, And we are the one that decides if we want to go to the left or to the right. And our small action has an impact. Finishing, these are future activities in Young WFPHA. So the first one will be establishing a national youth representatives for every member country. Advocate for regional aggregation, again. Trying to, pursue the health in all workforce approach to expand the partnership, the non-health related partnership as well, and to push forward the capacity building courses for early career professional and students. The next events we are going to attend are this one, so WHA this year, UN high-level meeting in September, Summit of the Future on mid-September, third week of September, World Health Summit, European Public Health Conference, and ISMOF. There is some regional other missing here, so please feel free to fill this list with your proposal. That's it. So feel free to join Instagram, the membership form, via LinkedIn. It seems like an advertising. Yeah, and that's done. This is if you want to send us an email, and that's my QR code. If you want me to put the other, that's it. Thanks for the attention.
So thank you so much, Dr. Alessandro. So it's a wonderful, inspiring message. And yeah, I do totally agree with the small impact, small action with a big impact. And I do agree also with the global citizen. We all have the responsibility to care for a better environment, better global health. So yeah, I actually joined IFMSA events before, but now I know a new path. So I can join WFPHA. You see, I pronounced it correctly, right? Okay. Perfect. So I think I'm ready for that. So now next we have our last speaker, last but not the least. Let's welcome our third speaker for today, Ms. Huishen Liu. And so her English name is Shay, and she's a Master in Tropical Medicine student who brings a wealth of expertise to the realm of public health. So beyond her academic accomplishments, she serves as the co-chair of the Youth Empowerment Network for HIV Advocacy, demonstrating a fervent dedication to advocating HIV awareness and prevention among youth individuals. Furthermore, as a dedicated member of the Federation of Public Health Students Association in Taiwan, she actively contributes to various public health initiatives and advocates for the interest of students in the field. Moreover, her commitment to advancing global health is exemplified by her role as the Taiwan Youth Ambassador to the World Health Organization Assembly, where she adeptly represents the perspectives and concerns of the Taiwanese youth on the global stage. So please join me in extending a warm welcome to our esteemed speaker. So Shay, the floor is yours.
Wait 4 minutes. Let Let me try this first. Okay. Okay. So good afternoon, everyone. It's my honor to have a speech after these excellent seniors, and you must be so very tired, but yeah, I promise there's something interesting in the end of my presentation, so just looking forward. Yeah, and so my name is Liu Shay, and I'm one of the members of Taiwan Healthcare Youth Alliance for WHA, and also the co-organizer of this summit. So in this final section, I'm going to share my journey in HIV advocacy. But let's start from the beginning. Like most people, it was easy to dream big when we were a child. However, when we're growing older, we find that the reality is not like a movie or comic book. Instead, we find out that it is not easy to dream big. And that was the time we find out how ordinary we are. But does that mean an ordinary person cannot change the world actually? This brings me to the fact that I am lucky to be a Taiwanese. These small islands have told me that the individual idea can converge into the public opinions. And the public opinion can keep reshaping our future and history of the nations. So I realized that we often think ourselves too highly, but every great accomplishment probably starts from a simple action, just like other speakers just mentioned it. Yeah. So in my speech, I'm going to reinterpret the power of ordinary people and share my opinions about youth engagement. So last year, I've become the manager of Federation of Public Health Student Association in Taiwan. And it's an NGO, includes more than 60 public health students across the nation in Taiwan. And what we do, we share the informational posts about HIV issues such as communicable disease, HIV prevention and control, climate change, environmental sustainability, and the health policy. We also established the communication platform with the academic institutes and the government department to provide more opportunity and the space for those youth who are caring about caring about the public health issues, not only HIV. Yeah, and they want to. We provide a space for them to contribute their knowledge and the talent. So in this year, our major focus is on HIV and AIDS issues. To put it simply, HIV used to be an incurable sexually transmitted disease. But thanks for the antiretroviral therapies and precise diagnostic technologies, HIV has now become more like a manageable chronic disease. And if HIV patients adhere to their medication and maintain the viral loads undetectable, and also if their immunity cells remain within the normal range, even after having sex, the HIV will not spread into other people. So U is U, undetectable is transmittable, should be a solid concept. But there is still a strong stigma in our society and surrounds all the HIV patients. For example, like most people still think HIV can be transmitted by just casual contact. That is true because like my parents or my grandparents still think so. And even the professional workers like nurses, doctors, or dentists still have this kind of stigma. One of the stories was from my HIV friend, and he once told me he was usually put it into the last number of his opinion for when he went to see the dentist, and it is still very stressful for him to speaking about his situation because every time when he told to his friends or stranger that he is the HIV patient, that most of people were not willing to eat or going to exercise or doing any kind of daily activity with him. So stigma is quite a serious problem in our society. And we have to know that the medical problems can be solved by studying. However, the social challenge is harder to tackle. And if we cannot provide a more inclusive environment, even we use the best prevention, there will be a limited effectiveness. So that's why this year we fund the YENHA. YENHA is the Youth Empowerment Network for HIV Advocacy. We advocate for national HIV and AIDS issue and to eradicate the stigma surrounding AIDS, promotes the accurate information, and unites the society for improvement. So what we do, what is our strategies? First, we find out even the professional, even the experts will have the stigma. So our first top priority is focusing on healthcare students. And then we find out HIV and AIDS is not just a health issue. So we collaborate with other groups. Also, we work together in the futures. So like this workshop, because the first step is to put more accurate information to our healthcare students. So this workshop educate this kind of information, such as U is U concept, and also the precise treatment for HIV, and also sharing the difficulty of HIV patients. So we also kind of like push them into the nearby park to make them interact with the local people. So in this session, they need to interact with elderly, parents, or teenagers, or elementary children to explain the HIV and AIDS issue. So our participants say it was really challenging because different age and different group have the different levels understanding about HIV. But it makes them to start to think about how to use their knowledge from classroom into the reality, into the real world. Sorry. Oh, okay. And then we find out. We find out that the HIV is not just a health issue. Instead, it includes many aspects of social knowledge, such as the interpersonal relationship, or laws, and so on. So in this workshop, we invited the doctor, case managers, and the NGO leaders to discuss HIV and AIDS issues. The interesting youth can get more information about social aspects of the difficulty of HIV. And after this session, we have a role play workshop, which our participants need to play both as the patient and the counselors. So in this session, they practice to face the disclosure of HIV patient and try to give the suggestion for them. So after that, our feedback says our participants started to notice the words they use, because usually we use some offensive words when talking about HIV unconsciously. But after this workshop, they started to know how to use more neutral words when talking about these issues, which are really great for providing more inclusive environments. And then in April, during our biggest religion event, the Mazu pilgrimage. Mazu is our greatest goddess. And you can think like this activity is like walk the Mazu, something like this. Yeah. So in this activity, we collaborate with the local LGBTQ plus NGOs, and we try to promote HIV and AIDS knowledge to the people in the parade float. Despite we face many rejection because they are too busy for walking. Yeah, but every time we started to say HIV is not quite dangerous, this is a time they started to accept HIV patients. And we also encourage them to get the rapid test for HIV because everyone have the chance to get the information, to get the infection. And we need to let everyone knows it is very important for the disease control. And in fact, Mozu is the first religion group which accept the LGBTQ plus activity. So it reassures us the increasing openness of Taiwanese society, and it is really great. So from our previous activity, there are more than 70 healthcare students involved. And their profession covered from public health, medicine, pharmacy, social work, and etc. It is really important because our goal is not just focused on healthcare students, but also the social working, also the lawmakers, and other fields. And there were more than 65% of our participants were youth, aged from 20 to 24. And one of our workshops with street outreach, there was more than 20 citizens understanding HIV and AIDS issue and accept our advocacy. As for the statistic data, our feedback shows that after joining our projects, it significantly improved the healthcare student perception of HIV and AIDS. You can see the health education skills, understanding of you is you concepts has significantly increased. And the most important is that before joining our HIV projects, most of the people had the irrational and negative attitude toward HIV patients. But just joining one lecture or one-day workshop, getting know more about HIV and AIDS, their attitude was significantly changed from 0.7 to 0.3. So it highlights the importance of information promotion, and that's why we keep doing this. So let me introduce our biggest project, Sing for HIV. And why we do that? Because every time we found out that even we promote the information, it is hard to let other people accept this concept because most of the time it was pretty boring. Yeah, I know. So we try to make a song convey the concept of you equals you, and sharing the difficulties and the deep struggle of HIV patients by a warm song. So we hope this song can be really spread into the public and makes more people accept HIV and AIDS issues. So this song. And the special part is this song is the first song made by a healthcare student, and there was more than 100 youth involved. We also collaborate with Taiwan CDC and hospital. And then we released the song on YouTube, Spotify, KKBox, and etc. So far there has been more than 7,000 views on YouTube. But this is just our first step. And then we want to join the concert, join more activity for promoting this song and make more people know these issues. So now it's really my honor to share this song. And this song is titled As Usual. Okay, let me try. Sorry. Okay, just a minute. And if everyone can sing, you can just sing with us. And there's an English subtitle. Can we play this again? 可以从。 This is a dentistry student.
平稳的呼吸陪着我，
未完待续的美梦，还想看昨天的日落。
当月台的列车发动之后，剩下谁在原地停留？
票根紧握在手中，未来被模糊了轮廓。
Remember you， 聆听我不安的倾诉 ，Because of you， 沉重的心终于被轻轻接住。牵起手吧，我们的温柔都一样，别怕受伤，都在生活里跌跌撞撞，擦去泪光，感受彼此的成长，让爱交织，让爱成为日常。抱一个吧，我们的笑容都一样，解开迷惘，重拾过去的单纯向往，抬头仰望印象，清晨的暖阳，不维持爱一样的爱，勇敢去爱吧。
当街灯和霓虹点亮之后，看见了更多的笑容。裂缝开出了花朵，期待着明日的白昼。
认同了自己的脆弱之后，就不害怕大雨滂沱。地图带着我出走，那是一样的理想。我 remember you， 学习着微笑的孤独。Because
Does anyone know our song titles? Who knows? As usual. And why? Why as usual? Why? Does anyone know? What? Oh, what? Yes, yes, you are right. Thank you, thank you. And as usual, you is also hiding here. Yeah, so that's why we title it as usual. So, once a HIV case manager told us, we have a dream. We dream that one day HIV can be spoken about as casually as diabetes or hypertension, without any hesitation or fear. I don't think that the stigma can be easily eradicated. However, if we can update the old views into the new concept just from ourselves, this will be a significant step, even though it is very simple, but it will be a significant accomplishment in the future. And I believe youth are powerful because we are the age that started to think independently and create our own view and values in this world. And we are so curious about our society, environments, and futures. So that's why we have so much patience, want to do something. And I believe if we can do the right thing from ourselves, we can influence our peers, friends, family, and until the society, and also in the world. So that's why we are standing here on the global stage, right? And also, when we're growing older, we will be the majority of policymakers, influencers, and investors. There will be a time that we can really make a significant change. So if you believe something is right, just keep it in your mind as long as possible. 20 years ago, a little boy in Taiwan was died involved in sexual diversity issues. However, 19 years later, the same-sex marriage was accepted in Taiwan. And in this month, the first presidential office in the world to host a drag show was also happened. So it made me believe that our connection can keep inspiring the next generation and promote the next generation into the issues. And one day, maybe a decade or maybe 50 years ago, just like these issues, there will be a great accomplishment. I do believe that. So if you agree with my promotion and want to do something in the HIV/AIDS advocacy, I invite you to share this song as usual. This is a YouTube link to let more people know. So from you, from me, let's make a change. Thank you.
Thank you so much, Shay, for sharing us this touching song. And I just have a short question. So I know that Dr. Alessandra is also a musician, so what's your comment on this? Oh, maybe you can, do you want to share it?
Well, no, that was really good. It was really moving, actually. Because I was listening to the part when I was at my home. I was at the station in the link, and I really liked it. But now it was something really
more touching, right? When everyone starts to sing about it.
I felt like moved there when listening all of you singing together. So I think this is the powerful thing we're also looking for. And yeah, really appreciate it.
Yep.
Maybe to produce and make it go and also spread the global message. So maybe you can appreciate it. Way to distribute that. Can show up an example.
Yeah, it's actually really meaningful because it's composed of more than 100 students from different fields. Yeah, and then, and we actually have one singer. We actually have one singer here, in present. Can you wave your hand? Yeah. She's one of the singer, part of the video. Yeah. Okay, so thank you so much. So today we had the privilege to hear lots of esteemed speakers who have shared their expertise, experience, and visions for empowering youth in global health. So before we conclude, I would like to invite all of you to join us with a panel discussion where we can discuss with our speakers and exchange ideas. So may I invite Dr. Pochin Lee, Alessandro Bergoni, and Shay. So before opening the floor to our audience, so I actually have a question for the panelists. So I'm using my moderator privilege first. Okay, so knowing that we are all global citizens and we are responsible to promote a healthy environment and healthy global health environment, what are the most memorable moments from what you guys have led organizations, group leaders? What are the most memorable moments that you guys had and impact what you are doing right now? Could you share with us your experience? Who wants to start?
Okay. Sorry, you can have my ugly voices after the beautiful song. That's quite unfair for me, but thank you for the question. I think personally, I was the president of FMS Taiwan before. We held the International General Assembly in 2019. That preparation starts 2 years ago, starting with the political conflicts in Taiwan that we were requested, FMS was requested to rename the country or the origin of FMS Taiwan from Taiwan to Taiwan, China. So that series of strategies of international engagement, hosting a GA and me being internationally engaged in the international team, start with that. A memorable moment is that when I start to see young, now older, but young medical students at that time start to put their wishes of international engagement of Taiwan through this organization and through what we have been doing. That's the responsibility and the accountability that you expect that they are placing in you. And then in that General Assembly, we have more than 100, again, that number, more than 100 volunteers from all the medical students and medical schools supporting that single event for the entire week. That's something that is rewarding, that what we are doing is actually meaningful to these students despite some of the defeats or unexpected outcomes at the end.
My turn. Not a better voices now even. But it's a really good question. I needed some minutes to think about it, so it was really useful to get some of them. I think that the most memorable moment I have in my mind is when we hosted the ISMOF, the International Student and Young Professional Meeting in Rome. We had more than 400 young professionals staying in Rome. And what I noticed from that event onwards is that people are looking for this engagement. And this kind of, I mean, it's related to youth engagement, but it's not like huge civil society, health promotion, but just engaging, you can promote people, because they feel like sense of belonging, sense of being part of something. And this is something really valuable. So I noticed that people were thanking, that's why I remember as most memorable. Coming back and say, oh, thank you for that, thank you for this, and then going forward and keeping this engagement again. So yes, I love the community engagement. That's why for me, health promotion has lots to do with community engagement. Your turn now.
Okay, my turn. I can share my story about about the journey of HIV advocacy. To be honest, even after organizing a workshop for HIV and AIDS, I didn't think I am really advocate an issue. And actually, to be honest, I don't really care about HIV and AIDS after this workshop. But the time I really heard the story from the HIV patient, that was the time I realized, oh, that was really a thing. Because HIV patient once, for me, it's like a far issue from me, so far away. But once I really witnessed a deep struggle from a human, that was the time I realized, wow, that is really important. That is why I need to say something and doing something. So this is the most memorable time.
Thank you so much. I believe these impacts are really the motivations for us to go further. And yeah, for us youth, it's important for us to dare to dream and dare to cross out from our comfort zones to do stuff that maybe that can lead us to something it's uncertain, but maybe it could bring a better result. Yeah, so are there any questions on this? Oh, there. Can anyone give the mic? Thank you so much. Hmm? There. It's Mandy. Mandy. I'm sorry, he's lost.
So, thank you all for sharing a lovely speech, and it's really, really lovely. And what I want to ask is about generation gap. It's like everything you talked about, like no matter geopolitics or public health or maybe advocating for social issues, we're all facing a society that we're used, and maybe the elders wouldn't believe in what we say, or the elders wouldn't say advocate for the rights for these social issues. And I want to ask that, is there any solutions you guys have, or you have maybe a policy to help for these rights? Thank you.
Policy, I hear the keyword.
Okay. I think this is maybe something I miss in between. Why youth engagement? What is it beneficial at all to the government or the leadership? Apart from the very practical or pragmatic answers that ambitious leaders need to nurture their next generation of leaders, so their power or interests will pass on in the same group. But that's very dark side of politics. From the perspective of youth, there's also the question, like, why youth? I think we're not really, like you said, not devoting my 100% of time in HIV or AIDS, or we're not devoting on something singular. What we're aiming at is to create the cultural change in a society or in an organization or in a generation. So when you are old, when you are 40 years old, you will have that same stereotypes on the 20 years girl students, maybe sitting in that stance asking that question. So that's not something bad or definitely solid, unchangeable. So if you base that answers on, what you are really doing as a youth is you need to promote the cultural change, because this is, again, politics, science. Institution in the government or in many decision-making body is very solid. You cannot change the way parliament negotiate. You cannot change how parties come up with the candidates. So with the involvement of the youth, one, you bring the new way of doing things. Second, you bring the new way of resolving and dissecting the problems, because we know the new technology and we know the new development of issues in the world. How our previous generations see LGBT issues, drag queens, is very different from that's also different from how I see these issues, because we are, of course, generational gaps in between. So that's one thing, like very important thing, You always, and I request myself of achieving that, to ensure that cultural change possible and achievable by individual young people. But that's reverse that identity. Why you as a young people want to get into those platforms instead of doing private calls or private actions, what you can bring to this environment. Because, many times young people, they have been in international organizations for 5 or 10 years. Eventually, I'm the youth delegate of a country to WHA. I don't want to share the opportunity with others. I want to be that youth delegate for 2024, 2025, 2026, and I have that connection with the government, so I make use of it. That's also something we need to be very cautious as well.
That's a good question. I was thinking, I would like to resonate with that. I think it's a really good point. I was thinking while you were speaking about the fact that sometimes we feel like exclusion compared to the seniors from the activity, and a good way, how can we prevent that we won't be the same seniors of tomorrow? That's the question, I think. I think the best way is to keep in mind that we are surrounded by minorities everywhere, and this could be a good way of thinking. I always like to do that. Sometimes I forget how lucky and privileged actually we are. So doing that, I think, thinking about minorities that we have around us is something that helps us. And ours, like this video, lets you think about, okay, there is that, and I empathize with them. This is something, a process that we should go into. So keeping in mind all the society composition, that is not only youth, Sometimes we say, oh, we're youth, you are excluded. It's not that. I mean, we are also excluded, but we need to keep in mind when we will be tomorrow's seniors that there are all the components. So there is the elders, there's the youth, there's all the minorities, which can be LGBTQ+, which can be indigenous. We need to bear in mind all of that and bring together all the vision, hoping that tomorrow we can be, you know, all gathered society, embracing all the kind of minorities, majorities, and all of that. That's my point of view, at least.
Yeah, I can, based on this HIV songs, this is why we use song for promoting HIV and AIDS issue, because different age have the different perception of HIV and AIDS, and also in other issues. So what we need to do is just to transform our language or methods to promote our information, because most of the time they are not really accepted some concept. This is just because we didn't use the right word or right languages. So like my experiences is that when I play these songs to my parents, they started to ask, oh, so what's happening in this in HIV and AIDS? So there will be a great start for them to start to ask the questions and find something new for them. Yes.
Thank you for your insight. So I do believe that it is important for us youth to be flexible and adaptable. And it is also important for communication skills as well, and on how we will discuss on, like what Shay said, this issue. How will we share this information to maybe the elders and the minors? How do we convey the message as well, and how they perceive it as well? So due to time constraints, so okay. No problem.
I see many of you reacted when Shay mentioned that people are having very stereotypical ideas about HIVs. Like, people still think they can get HIV within context, and you feel that's hilarious. But I have to tell you, health is actually not a very easy knowledge to people. Because you're a healthcare student, you think people should be aware of that and accept that. It's actually technocratic. You know, for example, people might think that immigrants or refugees coming to a country will destroy the economics or the labor market of a country because they are cheaper, they replace the source of it. But that's not true. Economic research shows otherwise. It actually boosts the salary of the lower skilled people, and they help because they replace women. So women actually have better performances in their life careers. So that is also very different perspective. You might not know this as a health student. You might not get it directly. So we need to alleviate that intuitive thinking that we are phrasing public health issue in a very simple way already. So people who still believe otherwise is terrible. Like, that gap should, in your mind, should be alleviated, and that's important for doing public health advocacy, at least from my own experiences.
Thank you so much. Okay, so I really want to thank all three of the speakers who give us inspiring message, and I hope all of you are learning something and motivated with youth engagement and empowerment. So may I now pass the floor to Alina, please. Can you guys please stay here for the award certificate?
Thank you, Celine. And now let's proceed with the awarding of the certificates. It's my pleasure to invite the President of the Federation of Public Health Student Association of Taiwan, President Toby. Toby will present the certificates of appreciation. All panelists can take a picture together. Thanks, panelists and Toby. And we also would like to invite our speakers to come to the front to join us and take a group photo with our participants.
Ladies and gentlemen, thank you for your attendance today, for sharing your insight and thought about the humanitarian and the youth development. Sorry, any sound? Okay, sound, okay. It works, yeah, okay, sorry, again. Okay, ladies and gentlemen, thank you for your attending, for sharing your insight and thought today about the humanitarian and the youth development. First of all, I'd like to thank my colleagues and friends today. They worked day and night for organizing this extraordinary and a fantastic event. And sharing with our insight about the global health initiatives. Besides, they're inspiring people nationally and globally. I'd like to say we are the healthcare professionals. We cure people. And we are the global and the world citizens. We care people. Additionally, not only cure and care people when people got injured, we also figure out ways to prevent people from these risks. I like to say human beings are really creative creatures. They create so many things and they bring colors to the world. However, sometimes we make some mistakes, such as war. War is a stupid thing we created. War is a disease preventable. Now, I'd like to, with pleasure, to thank all of you. You engage in this event. We will cease the conflict and foster next generation, generation to generation, and with our to pursue a commonality within the globe. And during our process, we will learn from the seasoned pioneers and learn from new voices to know their perspective, to pursue our community within the globe. And we'd like to invite you to join our journey, this exciting and inspiring journey. Thank you all, and we are the champions for the public, for the health. Thank you.
Okay. On behalf of Taiwan Healthcare Youth Alliance, I want to express our sincere gratitude to everyone who made this event possible, our speaker, panelists, moderators, staff, and of course, all of you, our participants. Thank you all for having me today, and until we meet again, take care and stay inspired. Thank you, and have a nice day ahead.